Good morning and welcome to the meeting of the Board of Supervisors for Tuolumne County for December 15th, 2020. I'll turn to my left and ask if Supervisor Rotifer would like to lead us in the Pledge of Allegiance.
I'd be honored. Ladies and gentlemen, please rise and join me in the Pledge of Allegiance to the flag representing the greatest nation on earth. Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
Under God,
indivisible, with liberty and justice for all.
I kept trying to slow down to catch up with Sherry.
It doesn't work.
All right, well, thank you for very much for being here. Clerk, would you please read the public comment procedures?
In order to protect public health and the safety of our Tuolumne County citizens, this Board of Supervisors meeting will be physically closed to the public. During the board meeting, citizens who wish to comment should be prepared to use our call-in line at 209-533-6581 to queue for verbal public comment. Public comment will be open and closed individually for each agenda item listed below. If you wish to comment on a specific item, please call in when the board clerk has read the item. The chair will ask if there are any comments from the public, and at that time, your call will be taken in the order it is received. The public comment time limit on each item is set for 3 minutes per speaker. The time limit does not apply to staff. Options for public access audio and video live streaming. The public will not have access for public comments through these media. These are available for audio and visual only. Option 1, our Tuolumne County website, www.tuolumnecounty.ca.gov/745/board-meetings. Option number 2, www.accesstuolumne.org and click Watch Live. Option number 3, Zoom webinar via your computer at https://zoom.us/j/987-373-85155 and or by calling in at 1-669-900-9128 with webinar ID 987-3738-5155. Important public notice under the Governor's Executive Order N2520. This meeting will allow members of the Board of Supervisors to participate by teleconference. And under Order N2920, accessibility requirements. If you need SWIFT special assistance during the board meeting, please call 209-533-6581.
Thank you very much for that, Ms. Ryan. So at this time, we'll open the meeting for oral communications. Public may speak on any item that is not on the printed agenda, and no action may be taken by the board. So is this for the public or a staff report?
For the public.
Okay.
Thank you. Good morning, members of the board, CAO Riggs, County Counsel Sarah Carrillo. I am your District Attorney, Laura Krieg, and on March 21st, 2005, I arrived at the Tuolumne County District Attorney's Office full of excitement and energy to start my new job as a Deputy District Attorney, then working under District Attorney Donald Segerstrom. I could never have imagined the fulfilling and incredible career that awaited me. After nearly 16 years as a prosecutor and 6 years as the elected district attorney, today I come to you full of excitement, but also with a host of mixed emotions, to announce my resignation effective January 3rd, 2021. As you know, I was fortunate enough to be elected to the vacant judicial seat on the Tuolumne County Superior Court, and I will be sworn in on January 4th, 2021. Words cannot express how deeply honored I am to the voters of Tuolumne County for electing me as their next Superior Court judge. While I look forward to the future on the court with excitement and energy, I cannot help but reflect on my past as a county employee. And without any hesitation, I can truly say that it has been my absolute honor to serve as the Tuolumne County District Attorney. It has been the best job I could have ever asked for, and I am so very proud of the District Attorney's Office and all that we have accomplished. I want to first and foremost thank my coworkers in the DA's office who work tirelessly every day to seek justice and to protect our community. It has been my privilege to be surrounded by such dedicated and well-principled prosecutors, investigators, victim witness staff, and support staff. I want to thank my family, my husband Dave, who's here today, for supporting me all of these years in pursuing this work. Many, many nights, Dave is the one who makes the dinner and puts our child to bed. I could not have done this job without his unwavering support. I would like to thank my colleagues in law enforcement, the defense bar, and county government for their commitment to excellence and the Tuolumne County Gold Standard, and their support for the District Attorney's Office over so many years. I want to thank this board and the previous board that I served for always supporting the District Attorney's Office and sharing in our mission to protect the county. I want to express my gratitude to the citizens of the county for electing me to serve 2 terms as their district attorney. It has been a privilege of a lifetime, and words are not enough to express how extremely grateful I am to the citizens of Tuolumne County. Thank you for trusting me with this profound responsibility. It is a responsibility I have never taken lightly. As Robert H. Jackson, who served as the U.S. Attorney General prior to serving on the Supreme Court, told his group of prosecutors in 1940, the role of the prosecutor is the most, quote, powerful peacetime force known to our country. The prosecutor has more control over life, liberty, and reputation than any other person in America. He went on to say, in describing qualities that make a good prosecutor, a sensitiveness to fair play and sportsmanship is perhaps the best protection against the abuse of power, and the citizen's safety lies in the prosecutor who tempers zeal with human kindness, who seeks truth and not victims, who serves the law and not factional purposes, and who approaches his or her task with humility. Throughout my career, I have always recognized the immense trust that the office of the district attorney holds. I have always done my best to do what was right and just for all involved. Thank you for trusting me.
Mr. Chair, Mr. Vice Chair, Laura, that was very eloquent, and you touched on so many things there. But I think the important thing is that you're really not going anywhere. You're still going to be here. So thank you.
Thank you.
And now you'll be passing judgment on the people that used to work with you. Congratulations both on your years of service to this county, very, very commendable years of service, but also on becoming a judge. And good luck to you.
Thank you.
Short and sweet. Just congratulations. Like John said, though, we're really fortunate that you're still staying in the community, and just God bless you and be with you. Then the next phase of your life, I think you'll serve the community well moving forward. And thank you for your service.
Thank you.
Yeah, I agree with all those statements. You've served us well as district attorney, and I think you will serve this community extremely well as judge. And we're glad to have you here and to have you as one of the arbiters of justice in our community and in a variety of ways that you've served us up to this point and now in your new role. So thank you very much for those words.
Thank you.
I look forward to seeing you on the bench.
Thank you, Chairwoman Brennan, and I look forward to seeing you all on jury duty. Thank you.
I turned 70, sorry.
Okay, thank you very much. So we'll continue with oral communications. Do I have anybody waiting in line to speak to the board? Okay. At this time, we'll open it up to staff reports. Staff may present public service announcements, commendations of staff, and brief project updates, and no action may be taken by the board. Hi, Liz.
Good morning.
Good morning.
Members of the board, Vice Chair Campbell, Liz Peterson with the County Administrator's Office. I just want to make your board and the public aware of some funding that was recently acquired by the county. This was, so recently Tuolumne County received $8.67 million from the U.S. Forest Service Washington office, adding to the $11.2 million it already acquired from grants and direct funding to support fuels reduction and other restoration work on the Stanislaus National Forest. Funding, I'm just going to read, an excerpt from the press release that will be issued right after this meeting. Funding will be used to implement priority fuels reduction treatments around the communities of Cedar Ridge and Cold Springs, as well as pre-implementation activities such as archaeological and botanical surveys, property line survey and posting, road maintenance and reconstruction, in support of future restoration treatments in the larger landscape of the forest. These projects and activities are part of a greater effort between the Stanislaus National Forest, Tuolumne County, YSS, and other partners working together in shared stewardship of our national forests. In 2017, the Stanislaus National Forest and the Tuolumne County Board of Supervisors entered into a master stewardship agreement for the primary purpose of retaining and restoring ecological resilience of national forest lands to achieve sustainable ecosystems that provide a broad range of services to humans and other organisms. Projects developed under this MSA are designed to protect, enhance, and restore forest and watershed health while bringing economic opportunities to the area. The MSA provides an opportunity for parties to seek funding, expand partnerships, and ultimately increase the pace and scale of forest restoration activities on the Stanislaus National Forest. The Cedar Ridge and Cold Springs fuel reduction treatments will complement the Strawberry Unified Prescribed Burn Plan located adjacent to the communities of Cold Springs and Strawberry, which is currently being prepped for implementation by Tuolumne County and the Stanislaus National Forest under the MSA. That prescribed burn preparation was funded through a California Climate Investment Grant awarded to Tuolumne County on behalf of YSS. With the 2020 fire season not yet over, it is becoming even more evident that we need to do something different to change the trajectory of our national forests and communities located within the wildland-urban interface, said Jason Kiken, Stanislaus National Forest Supervisor. Developing effective partnerships with those who have common interests is critical to ensuring the resiliency of our national forests. Our partnerships are crucial to leveraging the resources needed to maintain the forest's ability to provide valuable ecosystem services such as water for drinking, agriculture, and power generation, forest products to support local economies, as well as opportunities for recreation and tourism. By coming together and leveraging funding, expertise, and other resources from a variety of stakeholders, we hope to demonstrate that we can make a real difference in increasing the resiliency and sustainability of our national forests and our communities that rely upon them. So thanks, just wanted to draw your attention to additional funding that is headed our way. That's all.
And it keeps on coming, doesn't it?
Thank you very much for that. Any other staff reports? Okay. Seeing none, let's move on to our consent calendar. Clerk, would you please read the consent calendar, please?
Item 1, approving the minutes of the December 1, 2020 meeting. Item number 2, directing the board clerk to post a notice of vacancies for calendar year end 2020, including all current and future vacancies through December 31st, 2020. Number 3, approving of the Microsoft licensing contract renewal in the amount of $289,317.35 a year for 3 years for a total of $867,952.05. Item number 4, accepting the annual report of accounting activities relative to the traffic impact mitigation fee activity report for fiscal year 2019-2020. Number 5, accepting the annual report of the accounting activities relative to the county's other traffic mitigation funds for fiscal year 2019-2020. Number 6, accepting the annual report of the accounting activities relative to the tribal road traffic mitigation funds for fiscal year 2019-2020. Number 7, accepting one-time funding of $6,400 from the Department of Housing and Community Development to implement Transitional Housing Program Services, Round 2. Number 8, approving an update to the Executive Clerk Confidential Class Specification. Number 9, approving of revised class specifications for Animal Control Officer Recruit 1 and 2, establishing pay ranges and associated range changes of current staff. Number 10, approving of a new class specification for Solid Waste Director, establishing pay ranges, bargaining unit assignment, and modify the position allocation for the Solid Waste Division. Number 11, approving of minimum wage range adjustments for the office assistant, senior office assistant, election worker, and personal care assistant. Number 12, approving the reappointment of Rex Wisnan to the Tuolumne County Commission on Aging with a term to expire December 31st, 2023. Number 13, consideration of recognizing $2,500 in unanticipated revenue from Combined Arms to support veteran services in Tuolumne County. 4/5 vote required. Number 14, adopting Resolution 106-20, approving the summary vacation of a public road easement as described in Exhibit A attached to the resolution. Number 15, adopting Resolution 107-20, changing the term of the upcoming civil grand jury to an 18-month term. Number 16, approving a standard agreement for professional services with Siegfried Engineering for services associated with the design of the bridge and roadway for the Big Creek Shaft Road Crossing Big Creek Bridge Replacement Project in an amount not to exceed $139,926.35, and authorizing the chair to sign the agreement. Number 17, adopting Resolution 108-20, approving Amendment Number 5 to the 2017-2021 Tuolumne County Employees OE3 Memorandum of Understanding.
Okay. I'll look to the board to see if there are any comments on the consent calendar, or if you would like to pull any items. So I'd like to pull item 3 from the consent calendar, and then I have one comment after we look to see if there's any public comment. Okay. So I just wanted to talk a little bit about the contract for OE3. It was put on the consent calendar because of time constraints, and we have a very busy agenda today, but I hope that that does not take away from the importance of this item. The employees covered by this MOU are the backbone of this county, and the board cannot express how much we appreciate all these employees and everything that they do for the county. We want to speak to the reasonableness of OE3 during these really difficult times and during these negotiations, and appreciate the friendly and cooperative way that they've approached the county. It's very clear that OE3 has been watching the board meetings, and that it's clear that there's an understanding of the fiscal situation of the county, and the cooperation that we've seen has been really heartening and showing that we as a county are in this together. So I just really wanted to highlight the appreciation of working with OE3 as a group, and then we can move on to item number 3.
First, you have to vote on the rest of the consent calendar.
Okay.
So I'll go ahead and I'll move on the consent calendar, except item number 3.
Second.
Okay, I have a motion by Supervisor Rotifer and a second by Supervisor Gray. Clerk, would you please call the roll?
Supervisor Sherry Brennan?
Yes.
Supervisor Ryan Campbell?
Yes.
Supervisor Anaya Kirk?
Yes.
Supervisor John Gray?
Yes.
Supervisor Carl Rodefer.
Yes.
All right. Passes unanimously. All right. Could you please read again item number 3?
Approving of the Microsoft licensing contract renewal in the amount of $289,317.35 a year for 3 years for a total of $867,952.05.
Okay, and I'll talk to the reason I wanted to pull this item was not for, it was more for the size of the contract, and that as stewards of public money and the public good, we need to talk a little bit about why we need these types of contracts. And so that was my reason for pulling it. So.
Morning, members of the board. I'm Roger Root, your IT director. I can fill in some details and then answer any questions you might have regarding the contract. Microsoft has moved to a different type of platform for their licensing and really kicked it off in 2014, 2015, where you have to pay for a subscription based on the number of users that you have. The county first engaged with this kind of contract in 2017. And then when I came on board, we actually utilized the licensing to move to Office 365, so all your emails in Office 365. And this last year, we've deployed a lot of the other tools within Office 365, like Teams and SharePoint and OneDrive, which are all the tools that come as part of the licensing. Our contract expires on 12/31. When we initially licensed in 2017, we had 713 licenses. Those licenses grew over the course of the 3 years to 793 licenses. This last few months, I've met with several of the departments that have different license needs. And what we've done is we've reduced the total licenses down to 775, and we've actually added a mixture of licenses. So when we originally went with the Microsoft contract in 2017, everybody got the exact same license. So it didn't matter what you did, you had the exact same license as everybody else. That means that our road crews, who rarely use a computer and predominantly use it for safety training and to get some information and sometimes access their pay stubs and things like that, are paying the same amount as someone like myself who's on it every single day for hours and hours and hours. So what we've done is we've taken a group of those users and we've reduced our licenses down to a less expensive license that's about 50% of the cost of the full license. So for those users, they'll have that license that's significantly less. But in other areas, we've actually increased the licenses. So almost all of Health and Human Services are moving to a higher license that provides them with additional security features. It also provides them with compliance features. So it allows the compliance officer in Health and Human Services to have a dashboard where she can see real-time information regarding everybody's email and how it's fitting within compliance, documents that are stored on OneDrive, documents that are stored on ShareDrive. And it does a lot of really... it has a lot of features that really benefit the compliance piece. So I'm just going to use this as an example, but if someone puts a Social Security number in an email and they go to send it, it'll prompt them and say, hey, this has a Social Security number in it. You need to encrypt this email. Some of these features that we're not using today are available in the higher license that we'll be getting for them. We're also getting that license for all of the IT department. Anyone who has admin access in the environment should have those extra security features. Another addition to this contract is we added additional SQL licenses. So just staying compliant with the number of SQL databases we have throughout the organization, and the number of virtual servers we have throughout the organization, we have to increase slightly to adjust for that. We also have added auto conferencing. That allows us in Teams to have meetings and to have a local phone number that we can use for the audio conference. So those are some of the features we've added. We've added a lot of other features that I could go into a lot of details on if you want. But our contract overall increased by a little bit over 11% over the last 3 years, which is actually pretty standard. Most of our subscriptions increase by 3 to 5% per year. And we anticipate that will continue to go on. with that percentage of increases. I believe that both myself and the county staff that have worked with me on the licensing have done a diligent job at making sure we get the correct licensing for the correct staff, and working with the vendors who provide the most efficient pricing. One of the other features with this contract that we didn't have available before is the reason our licensing went up to $793 was we would have to pay for licensing for an entire year for like recreational staff that may work 3 or 4 months. But if they want to log into a computer, they have to have a license. And so Dell offers a license where we can just pay by the month, and it's about the same price as the monthly subscription from Microsoft, but we pay for 3 months and we don't pay for 12 months, whereas before we had to pay for 12 months for those licenses. So with that, any questions I can answer?
Any questions from the board?
I just have it's a quick question, but when we say we have 713 or 93 licenses, is the license associated with a person or a device?
Yeah, so licenses are associated with the person. And that number 775 includes all county staff, and it also includes, we have to have a couple of administrative licenses to manage the tenants within there, so that we have one for pretty much every function.
Okay, thank you. And I don't have any questions other than I appreciate your diligence. This is obviously your area of expertise, but being up here for 2 years, I know whenever you get before the board, it's always it's just very thorough, and you've saved us a lot of money in a lot of areas that a lot of people don't understand. And so I appreciate you coming into this organization and being thorough and being a good steward of the taxpayers' dollars.
Thank you.
Thank you.
And and I thank you very much for boiling down a very large and very complex contract that took a great deal of time, I'm sure, to work on. It took a great deal of time to read through.
Yeah.
So, and thank you very much for explaining it in a very clear and concise way.
Okay.
So with that, I will look to see if there's any public comment. So no public comment. Do I have a motion to approve?
Move to approve item 3.
Second.
So I have a motion from Supervisor Gray, second from Supervisor Rotifer. Clerk, would you please read the roll?
Supervisor Sherry Brennan,
Yes.
Supervisor Ryan Campbell,
Yes.
Supervisor Anaya Kirk,
Yes.
Supervisor John Gray,
Yes.
Supervisor Carl Rotifer.
Yes.
All right, votes. Item 3 passes unanimously. All right, so at this time, we'll move on to our our only 9 a.m. appointment. It's a presentation and planning status update on the novel coronavirus. Morning, Rebecca.
Good morning. Good morning, Vice Chair Campbell, members of the board, Ms. Carrillo, Ms. Riggs. My name is Rebecca Espino, Health and Human Services Agency Director. Today's presentation will focus on surge planning, and we have executives from our Adventist Health Sonora Hospital who will join us today, and we are really grateful for the time that they're spending with us this morning. We will also discuss our vaccination plan, which would not have been possible without the support of Eric Earhart, Ed Hogue, and his facilities team, who really moved mountains to make sure that our freezer was prepared and ready to receive our county's allotment of vaccines. Also, due to the length of today's presentation, we did not include a non-medical related impacts of COVID, but we will resume that portion of the presentation in January. Thank you, Dr. Sergey.
Good
Morning,
morning,
Doctor.
Vice Chair Campbell. Good morning, Chair Brennan, wherever you are, and good morning, other board members. Eric Sergienko, your interim health officer. Give you an update on where we are with COVID-19 as of the 15th of December. As you can see from the first slide is that over the last 2 weeks, we have seen an increase significantly in the number of new cases in the county, going up by 721. But a number of those, as you'll notice on the last bullet under Tuolumne County, are associated with the Sierra Conservation Center, which has had an outbreak that has started about a week and a half ago and has now accumulated 260 cases as of yesterday, with more coming today. That said, we continue to see hospitalizations related to COVID, and as indicated, the Adventist Health team will be on in about 15 slides to talk about our surge plan. We do have currently an additional patient that is not indicated on this slide that is currently in the ICU. As you can see, we have 273 active cases, but I would draw your attention to the epidemic curve, which is the bar chart with the red bars, is that we continue to see surges in cases. That continues to go up, even if we took away the cases associated with the Sierra Conservation Camp. If we look at it by date of episode, there is a slight decline. I don't know if that is a trend or you'll see little wavelets in every given wave, and I think this is more likely that, but also may reflect, again, people adopting disease reduction behaviors that we've talked about at length in previous presentations. Next. I will say, though, overall, if we smooth it out for the state of California, we look at their data, they're still looking at an explosive growth in cases and in hospitalizations, as well as deaths across the state, where yesterday was both a record-setting day in a bad way for a number of new cases and number of hospitalizations. When we talk about surge, we'll talk about where we're going as both a county and as a region in that direction. As most of us are familiar, there is a stay-at-home order in place for the San Joaquin Valley region. That does not mean that the tiering mechanism is going away. What will happen is that when we come out of the stay-at-home order, we will go into a tier based upon our current case rate and test percent positive. So as of today, we still remain in the purple tier. And as embargoed information that will get released at noon is our case rate has gone up from the previous assessment back on the 8th of December of 36.6 per 100,000 to 45.3, but our test percent positive has dropped a little bit from 12.6 to 11.2. So again, a little more on the regional stay-at-home order that has gone into place since last we met. This was driven by a concern over the availability of ICU beds, with the threshold being 15% or less available within the region. And we are within the San Joaquin Valley region, which is defined as being from Kern County up to San Joaquin County. And that truly reflects where our ICU patients go when they cannot get the care they need at Adventist Sonora. And currently our ICU beds are 0% probably means there's a half dozen beds or a dozen beds in different locations, but effectively it means it's very difficult to move patients from one location to another. And indeed, this extraordinary measure to basically have people stay at home as best possible, or what I think is staying closer to home, is because of the number of hospitalizations going on, the lack of healthcare surge, or having met that surge. And so what we need to do is reduce the number of cases, because by reducing cases, that reduces our hospitalizations about 2 to 3 weeks out. So we're continuing to see a high level of transmission within Tuolumne. We have dropped from being number 3 or number 4 down to the 18th highest. And again, this is 14th highest in terms of test positivity. But we are continuing to do case management and contact tracing, where we have the state team on board supporting us using our software called CalConnex to do our contact tracing. Since last we met, there has been an update in the quarantine guidance based upon both the CDC guidelines and then the CDPH guidelines. The CDPH guidelines being released on Monday, and that changes the quarantine period from 14 days for most populations down to 10 days from the time of last exposure. And this does incur some risk. We know that the majority, 99.99% of people on day 14 have no risk of transmitting disease. If we let someone out of quarantine at 10 days, there's about a 1% risk of spreading disease, of becoming infectious. And that's why we ask people to continue in that 10-day, from the 10-day to 14-day period, to continue to self-monitor and to continue to wear a mask and to isolate themselves should they develop symptoms. But we feel that we would gain better compliance with a 10-day program than a 14-day program, given the low risk associated with that. Not much change in terms of our type of transmission. Again, we're still seeing cases that are occurring in the workplace with clusters. I will say under the Cal-OSHA emergency regulation is that starting in the new year, we will be reporting clusters of cases in the workplace, not by the name of the workplace, but by the type of workplace, such as a restaurant, a healthcare facility, and so on. Now to talk a little bit about surge, to give you a snapshot of where we're at within the state and available hospital beds next, is that we continue to see an increase in the number of hospitalized and ICU level patients, with the number of ICU beds available dropping on a daily basis, where 4 of the 5 regions indicated in the stay-at-home order are below that 15% threshold, with both Southern California and the San Joaquin Valley region well below 5%. We're on any given day, we may be at 0, we may be at 2, somewhere in that 3 to 0 range of available ICU beds. That said, we continue to look at our models here in Tuolumne County. As I presented to the board 2 weeks ago, our modeling at that point, based upon our growth in cases, was anticipated to be 33 at the maximum. And now, because of that decreased transmission that I mentioned earlier, is they're modeling us out to peak at 11 patients on the 13th of January. Now, again, this doesn't model out who goes to the ICU or who goes into a medical surgical bed, but gives an indication of how to plan for eventual cases. We've been working, again, in conjunction with Adventist Health, our EMS providers, and state agencies to build capacity by recruiting disaster health volunteers, by using public health staff, looking for state help. And again, they're building out a nurse corps that can be that can deploy as needed in small teams to help out with critical care. But I am going to hand it over at this point, and I'm going to assume it's some sort of technical magic that I don't want to touch, to have the Adventist team come on and talk about their surge planning.
Thank you, Doctor.
Good morning. This is Dr. Hurd. I'm the Chief Medical Officer at Adventist Health Sonora, and thank you for this opportunity. As Dr. Surgenko alluded to, we've greatly leveraged and surge planning is happening.
So we're going to set you up with your microphone so that the public can hear your presentation. And just give us 1 minute here and we'll get you all ready.
Okay, I think we're good.
Okay, there we go. Thank you.
Cooking with gas now?
I think we're good. Apologies.
Thanks, Alex.
All right, I'll just briefly recap a little bit. We greatly appreciate working with our county public health and Dr. Surgenko.
I'm sorry, Doctor.
Quite a ride over the last couple of weeks. Our surge plan is actually going quite well. We are evaluating our bed staffing and ICU capabilities twice a day. We have gone up to a maximum of, I believe, 13 or 14 patients in the past. And some of the modeling Dr. Surgenko has given us greatly helps us anticipate future needs. Dr. Surgenko is correct in that it is difficult to transfer patients out, but currently in the local market, our ICU capacity is actually pretty good. Today we have 3 COVID patients in-house. Only 1 is in the step-down unit, and none of them are in the ICU. And we are better with our PPE supplies over time since the first surge in the spring. And I think we're in pretty good shape. But I would open up for your questions.
Okay, we'll stop there and I'll look across the dais to see if there are any questions. Supervisor Kirk?
Not so much for Dr. Herb, but maybe more Surgenko. You know, a lot of folks reach out to me and they say they see the 0% ICU capacity, but then, you know, Dr. Herb gets on and we understand we have capacity. Again, that's because of the region that we're lumped into, right? There's some counties that don't have any they don't have any beds, period. So the regional look is around 0%, but again, our local hospital does have capacity. Can you clarify that?
Yeah, so I think that's, you know, if you look at other hospitals, and again, it's an aggregate over the region, is as an example, Madeira Community Hospital is at 117% capacity for their ICU. Similar for Fresno, Stockton, Stanislaus. So in terms of the 6 beds we have at Sonora Adventist, it's a small amount as compared to the entire region. And I think the other thing to be mindful of is that while the team there is incredibly competent, there are cases that get sent down to the valley for subspecialty care that cannot be, or on a regular basis would be preferred to send to a subspecialist in the valley.
Do you have any, first I want to share, Supervisor Brennan, did you have any comments? Since I can't see you.
No. I just, one quick question, though, because I do have a little bit of a concern about, as we said, we have limited capacity. Would we see cases coming from the valley up here?
So I'm going to pass that back over to Dr. Hurd.
Sure. So we are being asked about our bed availability on a state level, a regional level. We're getting requests even from Southern California. And it's weighing that balancing act of what do we anticipate for the modeling versus what availability we have to be helpful to our neighbors and people who are struggling in other parts of the state. What I will say is that we are vetting each and every patient who we get requested for just to make sure that they are appropriate for Sonora and that we are not going to put ourselves at risk for overwhelming our capacity. And those are daily conversations that occur with other hospitals in the region.
Dr. Hurd, could you walk us through a little bit about what the plan is and how public health can help and coordinate with the hospital in the event that we do start approaching capacity for the ICU? We mentioned other hospitals in the region that are at over 100%, and with a relatively few number of beds, the room for expansion is fairly low. So what is the process and how can the county help in the event that we do start reaching capacity in our ICU? Where can we add beds? Where can we help you?
Yeah, it's a wonderful question, and we've modeled this in multiple ways. What we are doing is involving county public health in our meetings every afternoon, so that they know where we are. We can understand where the modeling is. I think it's a little misleading, the 6-bed capacity. Those are our 6 licensed ICU beds. We have the capability of doing ICU care in other beds. So if we got to that point, we could expand if we couldn't transfer out. We have expansion plans that can take a much larger cohort of patients if needed. And it really depends on what the surge is and how many, what we would need. I think our biggest stress point right now is staffing. Nurses are getting tired. CNAs are getting tired. Doctors are getting tired. And of course, they don't grow on trees, so it's hard to sort of come up with that. But the community public health is working well with us with some partnerships to help us find people and put out the word in case we need travelers and help. But we can expand, if we look at the patients that we've had, even at our highest surge, we only had 3 in the ICU at that point. Now, of course, there are other medical patients who may require intensive care level of service. And so what we would first do towards the surge is try to avoid those patients coming in for any reasons other than emergency reasons. And but so far the plan seems to be working, and we seem to be doing quite well.
So so essentially every bed in the hospital could operate as an ICU bed if that need arose. It looks like the choke point is in the staffing available to aid those patients. Am I hearing you correctly?
You are hearing me exactly correctly.
Okay.
We'll run out of staff before we run out of beds.
Okay. Thank you. Any other questions?
I just have a comment, and this is for Dr. Hurd and also his staff and the public. But in these kinds of crises, a lot of people lose sight of some of the very, very good hard work that's being done. And Dr. Hurd, please, I know there's a lot of frustration in the public right now, born out of fear and concern. But please let your staff know how much their very, very hard, over-the-top efforts and work are appreciated.
Well, I appreciate that, and I will certainly pass that on. And I think, we're trying with the staff just to stay positive on some of the success stories and support each other. And we feel it from the community, both sides of that coin, both the fear and the appreciation. But I will certainly pass on those words.
Thank you.
Yes, just echo Supervisor Rutherford's comments. I don't know where we would be without the hospital, and it's just an important asset to this county. So thank everyone that's there.
Any other?
All right.
Did you have
Any other comments from Alex, Dr. Hurd, or any of the other Adventist team?
I think that's most of what I have today. And if there are any other questions, you can always reach out to us here, and we're happy to answer them even outside this meeting.
Thank you for sharing your valuable time.
Thank you, Dr. Hurd.
All right, we're going to pause here a moment to do some magic, I think, to go back to our slides. Yeah. So one thing while we are moving around on the tail end of the surge planning slide is in planning with Adventist is one of the concerns that's been described to us by their case manager is a challenge in when you have someone who is well enough to be discharged from a general acute care hospital like Adventist, but is not well enough to go home, needs placement in a skilled nursing facility, but not being able to find a bed within a SNF, is the regional alternate care sites that had been established back in the summer are being reestablished. The Sleep Train Amphitheater in Sacramento went back into operation last week. They are accepting patients now that are falling into that low acuity.
And before you go on, Doctor, I just wanted to give a little note to the public. Anyone watching at home, they can view the meeting on our website under board meetings or access Tuolumne to view the slideshow and the presentation that you're giving right now.
Thank you.
And then I think, Heather, you have some more information on.
Do you want me to read that again?
Was that all you needed?
That's it.
Okay. So that's
Okay.
all we needed to share. So please
Got
continue.
All right, so as again mentioned, and the slides are now back up, is that the regional alternate care sites are opening in Sacramento, and then the other near one that is closest to us is in Tulare County at Porterville at the development center there, and that went into initial operating capacity yesterday. So again, as we have patients that can't go home safely but need SNF placement without finding a skilled nursing facility bed, these alternate care sites will accept them. going to hand it over to Shelley to talk about testing.
Good morning. Michelle Jaquetta, Tuolumne County Public Health Director.
Good morning.
I just wanted to give a little update on testing. So over 19,000 county residents have been tested at least once. The state site is now open 7 days a week, 7 to 7, for additional capacity. Testing is available from local providers, Adventist Health Sonora, and that OptumServe state testing site. We strongly recommend an appointment, as they haven't been able to accept walk-ins due to the large demand for testing for right now. So we do recommend that you get an appointment. Coming soon, our testing unit is working with the state testing task force to activate a traveling testing team that we will be sharing with Mariposa and Calaveras counties. In Tuolumne County, the plans are to have locations in Groveland and Tuolumne for additional testing capacity. Like I said, we're continuing our plans for that, and we hope to have that option up and running by January. Testing recommendations. We do recommend that you get tested as soon as possible if you are having symptoms. Every 14 to 28 days if you work regularly with the public, and 5 days after any travel. And please consider essential travel only at this time based on the state's travel advisory. Or if you've had close contact with others outside of your family bubble, plan to get tested 5 days after that potential exposure. If you have any symptoms, self-isolate and contact your healthcare provider. And again, testing is available by contacting your healthcare provider at the OptumServe testing site. The number for that, if you would like to call, is 888-634-1123, or you can go online at lhi.care/COVID testing. You can also contact Adventist Health's triage line at 536-5166. And we're going to talk a little bit about our vaccine plan, but before we do that, I just wanted to take just a minute to recognize the ongoing dedication and perseverance of our entire public health staff, going on 10 months of activation of our Department Operations Center, and those from the Department of Social Services who also have been assisting with the response. They continue to serve our community with grace under pressure, and I cannot thank them enough, so I just wanted to take this opportunity to do so. And I will second what Rebecca said in thanking the CAO's office and county facilities for their assistance in securing that very important part of the necessary logistics. Thanks.
All right. Well, I'm going to paraphrase probably poorly Winston Churchill. After the Second Battle of El Alamein, he said, "This is not the end. This is not even the beginning of the end, but perhaps it's the end of the beginning." And we do have vaccines. They are coming in today. We are receiving today the Pfizer vaccine, which is one of the two candidates that will have EUA approval by the end of this week, the other being the Moderna vaccine. We'll be receiving one travel case, if you will, of the Pfizer vaccine, which is 975 doses. That will be split between Tuolumne and Mariposa, with the majority of doses staying up here. But the intent about that is to get our frontline healthcare workers covered with a vaccine, because we know, as Dr. Hurd indicated, they're getting tired. They're in the trenches. They're doing work. We need to protect them as best we can. So the intent will be is that the 975 doses will be administered over the following week. Again, it will be frontline healthcare workers, and the vaccinations will be done largely by those healthcare providers. So as an example, Adventist will be doing what's called a closed pot of dispensing with their team, so they can get it into their arms as rapidly as possible. We will be receiving more vaccine next week. That's the Moderna vaccine. Again, given the number of healthcare workers we have in the county, it's likely that we'll be moving into additional populations of healthcare workers, such as EMS, but also moving into our long-term care facilities and our skilled nursing facilities. So it's definitely a work in progress, but it's exciting to see this come to fruition, and with the intent that we will have most of our healthcare workers and our long-term care facility residents vaccinated, or at least having the first dose of vaccine by the end of January.
We're going to ask Corey Allen to come up and speak a little bit about the Education and Compliance Division.
Good morning. Is this on? I cannot tell, so I will base it on your read. There we go. Thank you so much. Corey Allen, Health and Human Services Agency, and I'm really here to speak to you briefly about your education and compliance team. As we talk about the importance of health and within our community, it's critical that we look at what the businesses are able to do in order to thrive during these difficult times. Your board, and under the leadership of CAO Riggs and our Health and Human Services Agency Director Rebecca Spino, identified a need to provide education and compliance to businesses. We brought in staff that were on continuous furlough from recreation and library. And what we were able to do was truly serve the community by seeing through all of the complaints that were coming through our division and responding to them by supporting the businesses through on-site visits, plan reviews, etc. So what I want to do is just highlight a little bit of what we've been able to do. As you can see on your slide, which I'm going to open up in front of me as well, we have had 470 complaints come through our department since June. 30 of those came in within the last 3 days. 211 businesses have been identified as needing some support to stay within the ever-changing guidelines and orders. 15 additional businesses identified in the last 3 days. We are seeing approximately 65% of facilities are successfully addressing these complaints through the support of this community and the county as it's been put together through this division. We found until this weekend only 6% were openly dismissing those guidelines in order to either thrive or due to their own personal preferences. We're now starting to see a trend of a little bit of a change now that our restrictions are becoming more restrictive. We've conducted 30 technical assistance plan reviews in order to help businesses adjust. Some of those successes are that businesses, if you can change the slide, please. Thank you. That are eager to stay in compliance and to participate in this are very eager and engaged. They've enjoyed receiving the support of the team that's come to knock on their door. It's also helped us to develop a strong relationship with businesses so that when the tiers change, they've been able to reach out directly to us and ask for guidance. The best part of what we've been able to accomplish in the last several weeks has been through the grants that were issued through CARES funding. We've seen, and this was as of yesterday, grants totaling over $720,000 issued to local businesses, and that's to over 175 compliant businesses. And through your Business Education and Compliance Division, we provided each site visit to make sure that each business had the best information to stay within compliance. The challenge in front of us is simple. It's a lack of a tangible consequence should a business choose not to participate. Since the current stay-at-home order in place, complaints increased, and the level of, I would say, hostility has increased dramatically as time has gone on about the lack of negative consequences imposed on businesses. The expectation by some in our community is that we would simply close down or fiscally impact them. What we need to decide at this point is, as our CARES funding expires on December 30th or the end of December, do we want to continue outreach to support these businesses' needs through an Education and Compliance Division? Do we continue to respond to public requests for response and to business owners for assistance regarding current guidance and as they change? What I can say is I do not anticipate an increase in compliance moving forward. We have 3 options in front of us. The first one would be simply to cease operations of your Business Education and Compliance Division upon ceasing of the funding. A second option would simply be to modify that division, and the tasks would be limited to complaint management through letters of non-compliance. Call comes in, we receive the complaint, we respond with a letter to the business. We can do that through one assigned full-time supervisor, that is someone that's been dedicated to us who had been on furlough from the Recreation Department. We would minimize agency overhead and support to that activity, and we would fund it through a small COVID grant, potentially through reimbursements through FEMA, which comes with a 25% general fund match and does come far later after petitioning for that funding. And that would total $5,800 per month to continue that operation. A third option would be to continue to fund the Education and Compliance Division at operational level. The tasks would not only include responding to those complaints, it would include continued site visit, coaching, resources, and support. It would include the responsiveness to community complainants with specific feedback about how we're doing and what our process is, which is so important for our community to hear that there is a process in place. And then to continue doing plan reviews so that businesses can adjust as tiers and other regional orders change. That cost would include the full-time supervisor and the 2 half-time relief disaster service workers currently in place. And the total cost would come at $9,000. It got cut off our slide, so I cannot see the exact specifics. A little over $9,000 per month to continue. That funding, once again, would include a small COVID grant and potentially by petitioning for FEMA with 25% general fund. So with that, I just put that back to your board to say, we've been thrilled to work together with your board to meet your goals in ensuring that our business has thrived within this pandemic and throughout. The team has done an outstanding job, and I would be remiss if I did not say absolute thanks to that team for coming to work every single day, committed to meeting your goals. To wrap up, you can see any guidance documents that are needed for your business are there at https://covid19.ca.gov/industry guidance. And you can also see information around your Tuolumne County business support and assistance, both phone numbers. Any questions that you have in relation to business or education, I'm happy to answer them.
I just don't have any questions. I've got a couple comments. First of all, we are working diligently through our congressman's office, and it's beginning to look like there might be a break in the logjam in Washington, D.C., so we may be getting a supplemental funding to follow on to the CARES Act. We obviously won't know that probably for another week or two, one way or the other. So there may be continued funding coming down the road. The good news in that is we're really pushing very hard to get the funding out of the laundromat in Sacramento and come direct to the counties, and so that we can manage the money a little bit better. So hopefully that will happen. And the other comment I've got is, please, just like I told the doctor from the hospital, please thank your folks that are doing the grunt work. They're very often at the wrong end of a hostile phone call, and that's never any fun. But they need to know that they're doing very, very important work. I talk to small business owners every single day. A lot of them are very good friends of mine, and they all have differing opinions on what the guidelines ought to be, obviously. But they are all uniformly appreciative of the help, the assistance, the guidance that our folks are giving them. So please let them know that they're doing great work in a very, very tough environment, and that they're very, very much appreciated.
Thank you, Supervisor Rutherford. I'll pass that message along.
Yep.
Other comments?
I'm sorry. We will need an answer from the board in direction on whether or not we'll continue that division because we don't have another board meeting until January. They would stop working at 12:30 without direction from the board.
That was going to be my question. So do you have more to present? Because I'd like to have the public have an opportunity to weigh in on the compliance question.
We can close up real quick.
Okay, well, pertaining to CEO Riggs' question there. It's a funding question, and do we know for sure if that money is going to be shut off December 31st with what's happening in Congress right now?
Well,
Or-
this particular funding source will be, and we will have expended even beyond what we received. So we'll be submitting a FEMA claim no matter what. And Debbie and I will be meeting on Friday. She and I discussed this briefly yesterday. But her and Jason have been working very closely, and we do, at this point, I think we're expecting, and Deb, has been looking at this obviously much closer than I have, about 6 to 6.5 million. Our allocation was 5.5 million or 5.6 million. So the answer is yes, we do. The answer is no. I don't think that they're going to extend it, and even if they did, we will have expended it. It would have to be an entirely new funding source, as Supervisor Rutherford was speaking to. Hopefully, if they do approve that, they will make the expenditure period beginning January or December 31st. If they don't, and there's a gap, we would need just board direction to continue it, and then there would be a match, and we would do all of that during the mid-year budget, bring it back for you then.
What's the monthly expenditure rate on that?
I think what Corey just told you is about $9,000, maybe close to $10,000.
A month?
Yes, to do at the same level we're doing now.
Situations like this where we don't know enough to make it a competent decision are why we have contingencies. And I would think for $9,000 or $10,000 a month, we would commit a couple months of contingencies to see how this thing shakes out in DC and let the new board get on board and see where they want to go with it.
And our share of cost would be the $2,500.
Okay, that even more to the point. That would be my preference.
Because it's going to have to be sorted out when we really know.
Other comments from the board? Okay.
Hello.
Hi, Sherry.
I tend to agree with Supervisor Rutherford's comment and think that for the $2,500 that it would cost us, it's worth taking that out of contingency and give the new board a chance to get on board and lined up and sort all this out with where we're going from a national perspective.
My recommendation would be to commit to fund out of contingencies for January and February and let the new board deal with it.
So just to clarify that, starting January though, the grant funding to help the businesses would be expired, correct?
Right, it expires
So it would-
December 30th.
No. What we're talking about is
Right, no, but if, I'm just saying, so when you guys go out to assist businesses, we're really not assisting them with any more grant funding. It's more of just educational component, right? Okay. So I'm just looking at the numbers. Just correct me if I'm wrong, Corey. 65% of newly identified are still responding in a good way when you guys go out there and you communicate with them.
Can you restate the question? I'm sorry.
I'm just looking at the numbers. 65% when you go out to these new complaints, they're responding well.
Yes.
65%. Okay.
That simply means that as we do our observational walkthrough, they're completely compliant, and within some short period of time, we're not getting a follow-up complaint of the same. Okay. And that does happen a lot, and that's why our number is lower than 100% of compliance.
And do you think a lot of that follow-up and them abiding by is because of the grant funding, which will now be gone, or do you think it's just the communication?
That's
piece?
been consistent throughout the duration, and the more the restrictions we receive, the less compliance we receive as well.
Okay. Yeah, so looking at the numbers, I agree with Supervisor Rutherford, Brennan. I think for a small cost and for the unknowns, to fund it for a few months, if we're getting this kind of reaction, 65%, I still think that's a good response. If it was way lower than that, I would consider not, but I think it's worth doing a few months, seeing where the funding ends, and letting the new board at that time decide to move forward if the funding doesn't come in long term. So I'm fine with that.
Supervisor Campbell, one more point, and Debbie thankfully brought this up to us. We do have a lot of individuals doing contact tracing who are maybe relief employees or disaster service workers, and that would also need to be continued. Unfortunately, I don't have that cost in front of me. We can get that to you in the January board meeting, but right now, we would just need your direction and authority to continue all services as needed for response to COVID-19, and use of, possible use of the contingencies as that match, and we would have a better idea of that number when we come to the January board meeting.
Okay.
So you just need board guidance, you don't need a vote?
Yeah, I just need you to provide guidance that you want us to continue the service, and then we will come back. Like I said, that first board meeting, we can give you a better idea of what those costs are broke down by the different sections that we're providing.
Okay. So we're talking about option 3, funding at the current levels. So the main, you made a comment that there have not been any tangible consequences for the businesses that are not complying. I would disagree a little bit with you on that. I'd say that there are very strong tangible consequences. We've had 11 deaths since Thanksgiving. We've had seen our infection rates spiking very rapidly, and like many in the public, I've been very disheartened to see certainly the majority of businesses are compliant and are taking those efforts to keep the public safe and keep their customers safe, but there are some bad actors out there. And from my understanding of what you're saying is that you're not convinced that continuing on as we have been at the current operational level is going to have any more impact than we've seen in the past 2 months. Is that what I'm hearing?
That is what I'm saying.
Okay. And so it begs the question, is that money well spent if we're continuing on with this program of education and trying to aid businesses? It kind of sounds like the businesses that are following best practices with respect to COVID-19 safety are already have the tools that they need to do that, and the ones that are not following those best practices intentionally, and so there's not much more that can be done.
When I look at the list of recipients to the CARES funding going to businesses, there's not a great overlap between businesses that we're continuing to get complaints about. So that's where it gets difficult to identify that the funding would continue to increase compliance, because those businesses that are receiving the funding, for a great majority, are already fully compliant. They don't receive complaints. Potentially, there is some overlap.
And CAO Riggs, could you had mentioned that we have other staff that are connected, I guess, to the compliance management side of this. Is that a cost over and above, what is this, about $9,500 a month that we would be incurring keeping this going?
Correct. So for the education and compliance, we're looking at about $9,000, $9,500 a month, of which, say if we said $10,000, our match would be $2,500. The other staff I was referring to are contact tracers. So they're providing, not through education and compliance, but other support through public health to do all of the tracing that needs to be done. And Deb was telling me she thinks that that is more expensive actually than the monthly cost for our education and compliance unit. And that's why I'm thankful she brought it up. We need to discuss that as well.
Yeah. Yeah, and so it's for that reason that I tend to side more with option 2, which is to modify the education and compliance division. We want to keep it going. We don't want to have no option for residents to call and make complaints. But I also don't want to cease to waste our precious and limited resources having staff bang their head up against a wall.
Well, time out. Aren't we saying, though, moving forward, you're getting a 65% success rate with option 3 when you're going out to new businesses and
That
having
65% rate, it ebbs and flows. So each time I pull data, that's actually a number that's dropped. It had been closer to 70% until our most recent regional change order.
Okay, because I don't want to say it's not having any effect, because per the number, it is.
There is a
Well-
positive effect, yes. Those numbers are only dropping now with the most recent changes
Right,
because
okay.
it has been restricted.
It's moving, the target's moving.
I mean, would we not want to see that effective rate increasing at least gradually over time? Would that be the correct way to assess it? That, you would see more successes each week than you had the previous week. Whereas if we're just at a static number in terms of our success rate, more or less, even declining a little bit, that kind of demonstrates that it's not effective.
I would agree with what you're saying, and that's my concern, is that if we don't change the way in which we operate, we will only expect to see the number either flatten or to decline. I do not anticipate that it will continue to grow if we don't change something, whether it be through an incentive or a consequence. And I mean a fiscal consequence to a business who decides to be out of compliance or falls out of compliance. And I don't have an opinion either way. I just simply am saying that figure of compliance will either flatten or drop. Because I've seen it far higher. I've seen it as high as 75%.
Okay. I'm going to turn it over if there are any more questions from the board.
It just seems that, we have, I don't know, maybe we've kind of hit some sort of a wall here to where we don't think we're going to go unless we change. I don't think we have the capabilities right now of saying what that change is, but we still need to comply with what the orders are for the expenditures of the care funds. So I would say that, we give staff directions to do what Supervisor Rotifer mentioned, but you're going to have something else to come back with.
Okay.
Supervisor Campbell, I'm sorry, one short thing I just wanted to make sure is we do know that with this funding, because we did not get a direct allocation from the federal government, ours came through the state administration. We do know that our governor has put a lot more strings attached to that than what would have been had we gotten a federal allocation. My point to that being is that the Education and Compliance Unit did demonstrate the county's desire to have some level of enforcement of what the governor told us to do, keeping what I would feel a lower risk of having any type of take back at the end of this. So that was part of what this was about. And then I would just, for those listening and just as a general reminder for your board, our unit has generated letters to the state task force when there are businesses who are not in compliance. And we do know that some of those businesses have received letters from different state agencies when they're not in compliance. So there has been part of that. But I just don't want us to lose if we get another allocation that goes through the state of California, and it's our governor putting in those rules. If we can't demonstrate our desire to have some level of enforcement and education, it could potentially put us at risk. That's just one thing to think about as we move forward.
And jumping on that, and kind of linking back to what Supervisor Kirk was talking about, I think anybody that believes that somehow compliance over the period of time that we have endured this disease, and people are seriously being threatened with losing their business, that if the public really thinks that compliance is going to go up, people are getting worn out by this, okay? Not just emotionally, but financially, very seriously. And I think to focus on that trend when we still have 65% compliance, okay, that's 2 out of 3, pretty close. Let's focus on the successes of it. If we abandon this program, then we are likely to see a more precipitous drop than we would if we don't continue it. So we need to be thinking about trends and some of the very serious demands in people's lives out there that they're under. I think we need to continue this program. It has done us a great deal of dividends. It's done our business community a great deal of dividends. And I'm not going to be around in January, but I would like to see this continue at least long enough that the new board can get on and decide how they want to deal with this, okay? I don't want to shut it down on 31 December and then try to restart it again if all we're talking about is $5,000 for 2 months. So I'm in favor of giving staff direction on going with option 3, which is continue the program as it is. And if we need to, we tap into some reserves. And if the new board has a better idea how to deal with it, they can do that in January and February.
I would
All right,
agree.
so, sorry, any more comments? Okay, so you have a majority recommendation there. I'll look to the back to see, Doctor, did you have any more comments?
So I don't know if the CAO needs further guidance on the contact tracing, but that is a critical element at this point as well, actually. And I do appreciate the CAO's comments about linkage to enforcement, working with our state partners. And I will say that we do get a daily report of visits from state agencies up here, and the ABC was up here yesterday, did 13 visits, and was able to gain compliance with all of their visits.
All right, I'll look to the back to see if we have any public comment. All right. All right, if there's no other comments from public health. Oh, we do.
Just 2 final slides, and I'll be very brief.
Thank
This
you.
is just our regular communications. The public can find information and data on our Facebook page and our Tuolumne County website. There's a community resources portal, and our call center, 533-7440, and always can email us at health@tuolumnecounty.ca.gov. And as always, to lower disease transmission and the impact of COVID-19 in our community, wear a face covering, maintain 6 feet of physical distance, minimize contact with people outside of your household, wash your hands and increase cleaning, stay home if you're sick, isolate and quarantine as instructed to prevent transmission, and get tested. That's it. Thank you very much.
Thank you.
Thank you.
And Dr. Surjenko, don't know if I'll see you again, but thank you very much for what you're providing to this county.
Well, thank you, Supervisor Rodefer, and thanks to you and Supervisor Gray, Supervisor Brennan, and best wishes for what comes after this.
It'll be interesting to see.
Yeah. I think your future is more interesting than mine will be.
Thank you very much. Okay. Clerk, would you please read item number 18?
Item number 18, consideration of approving a contract between Tuolumne County and Chavo Las Positas Community College District for Title 4-E specialized training services not to exceed $1,500,000 per fiscal year beginning December 1, 2020 through June 23, 2023, and authorize the chair to sign the agreement.
Good morning.
Good morning, Madam Chair on the phone, members of the board. I'm Michelle Clark, Deputy Director with Child Welfare Services. So I understand that the amount of this contract has likely raised some eyebrows, but what I hope to convey today is that there is no cost to the department or the county, but it will allow us hopefully to save significantly in training costs. So before I kind of get into that and the possibility of savings, I would just kind of like to give a little background on where this originated from. Excuse me, the mask, been wearing it for too long. So the federal foster care program, which aims to provide safe and stable out-of-home care placement for foster children until they are safely returned home and or placed permanently with adoptive families or placed in other planned permanency arrangements such as guardianship, is authorized by the Title 4E, authorized by Title 4E of the Social Security Act as amended. It is annually appropriated with specific eligibility requirements and fixed allowable funds, uses of the funds. The funding is awarded by formulas as an open-ended entitlement grant and allows specific program expenditures to administer the foster care program and to ensure the safety and well-being of foster youth. So included in those program or those eligible expenditures is enhanced specialized training. And it's actually available for various service providers who are in the profession of serving and protecting our foster youth. So training and professional development is critical to enhancing the skill set and maintaining a skilled workforce in order to provide quality services and allow our staff to make informed decisions for this vulnerable population. The other key point that I think is really critical and important to mention is that it is not only available to our child welfare workforce, but other professionals who are also performing this work. So public health, behavioral health, law enforcement, victim witness, all share responsibility in working with our foster youth, directly or indirectly, as are our resource parents caring for foster youth and many other health and services staff and administrators. So I also want to point out that recently there has been also legislation that is mandating us to integrate children's services across county sectors. So it includes our county educators. So I just want to make sure that training is going to be successful to the implementation of these, of integrating our children's system of care. So the Title 4E specialized funds really does allow for us to provide high quality training specific to the needs of our county at an uncapped amount. So long as the training serves that specific eligibility requirement and the purpose for administering our foster care program. That increases safety and improving our foster children's lives. So, although we have known about Title 4E and have been using Title 4E funding since its inception, we just became aware that we have the ability to claim this funding for training at this level with a vendor, and it was introduced to us in the past year. So various meetings were held with other counties who have successfully implemented this, and our chief fiscal officer also met with consultants to brainstorm how we might be able to implement it here in Tuolumne County. So once that research and groundwork was completed, we went out for a request for proposals, and the winning applicant happened to be Chabot, Las Positas Community College District. They have been actually experts in this for going back 18 years and are currently serving 6 other counties. My understanding is there's 8 counties that have implemented this, and they serve 6 of them. And we also received exceptional references from all of those 6 counties. So we intend to develop a robust staff development team who can manage not only the requirements of the state mandates for child welfare staff, and the required trainings, but for all of health and human services who play a part in this. This team will work with Chabot to outline specific county needs to serve our foster youth, including trainings for administration to help effectively lead, such as the high performance organization model trainings and other trainings. We also plan to provide high quality trainings related to safety organized practice, strong risk and safety assessments, child sex trafficking, and so forth, that we will also be able to invite our other county partners to attend at no additional cost. This work with Chabot, Las Positas, is expected to save Health and Human Services approximately $55,000 to $70,000 each year in annual training costs, and hopefully will also improve our outcomes. So we also hope that it'll strengthen our community partnerships because, as we know, we are all doing very high liability work. So I understand that this contract might look alarming, but that's because the funding is federally uncapped, and Chabot actually provides the 100% of the match required to draw down these federal funds. So with that, I am requesting the board's consideration to approve an agreement with Chabot Las Positas Community College District for Title IV-E specialized training services. And I also have some handouts that they have given us if you guys are interested, I know it sounds too good to be true, but really it is pretty amazing that we are able to bring this to our county and, like I said, actually save money instead of spend money. So if you guys are interested, I do have a couple of different handouts that might be able to help answer any questions.
I do have one question as far as how it happens. Does the college bring it to us, or do we have to take the people to the college?
No, so the college really customizes. We've actually started planning with them already, and no, they just, they kind of help us develop curriculum or seek other trainers, and no, they bring it to us.
Okay, thank you.
Any other questions from the board? Okay, I'll look to see if, is there any public comment on that? Okay, seeing no public comment, I'll entertain a motion to approve this contract.
So moved.
Staff recommendation.
Okay, so I'll give Sherry the benefit, Supervisor Brennan the benefit of slow.
And I'll second.
Phone line. So we have a motion by Supervisor Brennan, second by Supervisor Rotifer. All those in favor? Or I'm sorry, could you please read the roll?
Supervisor Sherry Brennan,
Yes.
Supervisor Ryan Campbell,
Yes.
Supervisor Anaya Kirk,
Yes.
Supervisor John Gray,
Yes.
Supervisor Carl Rotifer.
Yes. Good work.
Thank
Yeah.
you.
Wonderful job. Okay, motion passes unanimously. All right. Let's move on to item 19. Ms. Ryan, would you please read item 19?
Consideration approving the reorganization of the Health and Human Services Agency.
Good morning again.
Good morning, Vice Chair Campbell, members of the board. Today, I come before your board to request your consideration in creating a path for your Health and Human Services Agency to reorganize our operations to better meet the needs of our community and to effectively utilize our staff. My hope is that as you reviewed our reorganization proposal, you were able to see embedded your individual values that you have used to lead our county. As an example, Supervisor Kirk, you require proposals to make sense and for the finances to line up. Supervisor Campbell, you're concerned that we meet the needs of our vulnerable population. Supervisor Brennan, partnerships are very important to you. Supervisor Rotifer, you said something to me during a meeting that we had a few months ago. And what you said made my heart sing. Because what you said is, Rebecca, take care of your staff. That's your job. And that's what I'm here doing today. Supervisor Gray, you're always firm in your values, but your delivery is kind. And today, I am firm in my commitment to this reorganization, and my delivery is usually pretty kind. Before your board is an 11-page memo that goes into painstaking detail of our proposal. But today, I promise to only highlight the main points. As your board is aware, the Health and Human Services Agency is comprised of 4 departments: ambulance, behavioral health, public health, and our largest department, social services. But apart from sharing the same agency director, the departments, as long as I can remember, remain independent of each other. We want that to change. On January 17th, 2020, the entire 4-department leadership team met for the first time to get to know each other and to start strategically planning as an agency. During this meeting, it was overwhelmingly apparent that the team no longer wanted to work in silos. We discussed creating committees to battle our recruitment and retention problems, spearhead a staff development team, find methods to leverage funding and staff strengths, and to find a way to move to one campus. It was an exciting day, full of promise for the future. But 60 short days later, COVID hit. However, the desire for integration remained. So you may be asking, why now? Why make this change in the middle of a pandemic? Out of this pandemic darkness, a promise of what could be became evident. The pandemic identified missed opportunities that we have had for years to utilize the talent, dedication, and the skill sets of the staff that have gone underutilized in our organization. This is a visual of what an integrated agency looks like during a pandemic. This is a social services supervisor suited up with PPE, driving a refurbished ambulance on her way to transport a patient that was taken to the hospital to receive a COVID test, and that patient had no ride home. This same DSS supervisor is overseeing a public health contact tracing unit, and at the same time, she is attempting to perform her duties in social services. This utilization of staff and resources is what our community should expect. And this is what we want to deliver, a true integrated agency. The goals of our reorganization are many, so I will highlight a few. We must align our agency operations with our CAO's vision and expectation that we build a high-performance organization. This is done by partnering not only across the Health and Human Services landscape, but across county general fund departments. We must continue to build efficiencies in our operations to better serve our community. Our departments serve the same customers, and sometimes we serve the same customers on the same day. We must be efficient. We must leverage funding across the Health and Human Services Department and ensure this leveraging includes our general fund partners. We must provide a path to create flexibility within the organization to deploy staff where needed, and also give staff the opportunity to develop professionally beyond their designated department. The theme of these goals, as you will see, is efficiency and leveraging. So let's begin with building efficiencies. Our proposal is to abolish unique department-specific job titles and instead create one classification for staff who have similar work. As an example, there is currently 5 distinct job classifications that provide similar executive level oversight, and each have a different job classification and different pay. Creating one distinct deputy director job classification that serves an integrated agency will build flexibility to work across departments by deploying skill sets and knowledge base where necessary. As an example, you just heard from Corey Allen, our DSS, or our Social Services Deputy Director. She has an exceptional skill set of building programs. So when we needed to build a public health, education, and compliance division, Corey Allen was a logical choice to serve in that role. Every department head can attest the county has exceptionally talented staff and the ability to create a path to increase flexibility, improve succession planning, and create parity within the leadership positions is a needed step toward efficiency. Building efficiency is one step, but is also critical to build infrastructure, and that means hiring the right people in the right positions, which also includes hiring the right number of people. Maintaining and building an organization that is mandated to serve the highest risk, most vulnerable members of our community is best done when it provides high-quality service, effectively uses funding, and meets outcome goals and to meet goals and outcome measures. This is best accomplished when we have the needed infrastructure in place to be strategic in our approach to serve our community. Beginning in 2008, when the financial impact of the Great Recession devastated many of our departments, budget cuts throughout the county were primarily directed at our mid-level manager positions. And since then, every department head continues to experience the impacts of these cuts. As a result, your agency leaders are relied upon to do staff-level work, manage the agency, and when time permits, fit in leadership tasks such as strategic planning. The lack of strategic planning and the infrastructure needed to support that important work leads to status quo mindset. So when budgets get tight, we cut positions and programs because it's easier and quicker, rather than take the time to do this work strategically. So today, we are asking your board to smash the status quo. We are looking for another way to operate our organization. We want to continue to focus on creating a proactive approach to services, because right now, we are primarily reactive. We want to implement programs that prevent children from coming into foster care. We want to prevent the need for mental health and substance use inpatient treatment. We want to prevent unplanned pregnancies through education. We want to prevent families from needing public assistance. This great work cannot be done when our department leaders are writing court reports, supervising numerous staff due to vacancies, writing grants, and that's just to name a few. The Health and Human Services Agency is not unique. I am confident every department head can attest they are experiencing the same challenges due to the lack of infrastructure. As mentioned earlier, we need the right people in the right positions. The vast majority of the reorganization is satisfied by making adjustments in our existing staff. We are currently performing and expected to, staff who are currently performing and expected to continue to perform duties in advanced classifications. Out of respect for your board's time, I'm not going to go through every single conversion, so I'm going to focus on one because this is it's a telling of what is happening right now in the Health and Human Services organization, and I'm sure throughout the county. A staff services manager is typically responsible for one functional area of a department. Our staff services manager is responsible for many functional areas. So I'll take a deep breath because there's a lot of things I'm going to talk about her. She oversees program integrity, including monitoring fraud. She investigates data breaches. She monitors a child welfare quality improvement plan, serves as a presiding judge over administrative hearings, she is creating an oversight of staff development, oversight of IT and facilities work orders, prepare and facilitate automated system migration, oversees grants, procurements, and contracts, and that's just to name a few. This level of support is directly in line with a deputy director rather than a staff services manager. That is why I'm requesting a conversion of her position. Not only do we need the right people in the right places, we need the right number of people. Similar to the previous slide, I will only highlight one of the requested new positions. As your board knows, children are our community's greatest asset. Creating a system of care that focuses fully on children's needs is best done by integrating the multitude of services that are sprinkled throughout our agency. Adding a program manager dedicated to a children's system of care approach to serve our children will assist the agency in meeting current and emerging services. We strongly believe this position is an investment in our children. Integrating the Health and Human Services Agency and not using this opportunity to integrate with general fund departments just creates another silo. In early May, your county department started preparing for this year's budget, anticipating significant losses in revenue. During those dark months and ever since, we began to feverishly grant write. Fortunately, the state has increased many of our allocations, knowing the economic impacts of COVID would increase the number of Tuolumne County residents needing our agency services. And we were pleasantly surprised to be funded for a few upcoming mandated services. Not leveraging these funding opportunities with general fund departments is ineffective in building a partnership. Earlier, Michelle just shared the incredible success of one of our grant writing endeavors. We were able to secure $1.5 million of training that will be shared with every county department. Last year, your board invested general fund dollars on an excellent training that focused on building a high-performance organization, but the cost limited the number of participants. This new funding opportunity will allow many, many more members of your leadership team to participate and benefit from this exceptional training at no cost to the general fund. So this slide is a visual of your 4-department leadership organization, and the peak areas reflect the 4 new positions that we are requesting. Although we are a 3 large department organization, you will only see 2 green sections, your public health director and your behavioral health director. Because in my role, I serve as the social services director and the agency director, so that's why you only see 2 directors instead of all 3. One of the new positions in this proposal is adding an assistant to the department head to help with the administrative work that is tied to my responsibilities. The staff in green are existing staff that I am recommending should share the same job title and pay instead of having unique department-specific classifications. The next section down, the gray section, is our mid-level managers, and this is where many county departments made cuts during the Great Recession. The request before your board is to add 1 manager over our children's system of care and 1 manager over our adult system of care. The other requested position is a staff services analyst. This position serves as our grant writer, and so far, grant writers have proven to be a very, very good investment. So this slide is where the rubber meets the road. There is no cost to the general fund. The cost of the Health and Human Services reorganization for this fiscal year is almost $250,000. The cost for next fiscal year is almost $490,000. So you're asking, how are you going to pay for this? The Health and Human Services Agency departments are expected to stand on our own financially. We strongly believe this reorganization is sustainable through cost savings and revenue generating opportunities. This slide demonstrates just an example of our grant writing successes, the increases that we've received in program allocations, and funding for new programs. This funding totals over $1.1 million in revenue and does not account for the anticipated savings that is an expected outcome from this reorganization. In closing, I come before your board requesting your authorization to smash the status quo. It is my responsibility, in partnership with our agency leadership team, to look for continuous ways to improve the way we serve our community. Our community and your board should expect nothing less from me and my team. Investing in your Health and Human Services agency is an investment in the community we serve. Investing in your Health and Human Services agency is investing in the county departments that we partner with who are equally dedicated to the community that we serve. I respectfully recommend your board approve the Health and Human Services Agency reorganization to be effective January 3rd, 2021. Thank you.
Thank you very much. So I'll look to the board to see if there are any questions for Mrs. Spino.
Questions and comments? I think this is probably why we hired you. I'm not sure, but it could be part of it. You know, the last slide you put up that has to do with cost, you know, it's important. There's zero cost to the general fund, but I think the most important part is, and you've talked towards it, is can we do a better job, and how much better job can we do? And, you know, in reading all of the information that you supplied us, I believe it's well thought out, but I do have a question for CEO Riggs. Is, you know, we kind of work for her, so I'm just kind of interested in how she feels about this.
So I think it's not a secret. I think that Rebecca has been doing an amazing job. She did come to me in, I think it was early November, and she handed this to me in a 3-ring binder, and I took it home for the evening and over the weekend, and I read it. Then she and I met with Ann. We included Ann Frem, so we could make sure there's some consistency across the organization in the approach, and also to ensure that she had adequate support, such as the assistant to the department head, which was not included. I do absolutely support this. We've never looked at the organization as a whole, and I think that it is critically important. The only thing that I would like to see added, and maybe we do it at some point in the future, is you heard Rebecca speak that she's not only the department head, but she's acting in the role of the director of social services. And that does put her at a disadvantage at times because of the workload. So whether, you know, she and I did discuss that, and I think we may see that maybe a request coming at some point in the future. But anytime you have a department head who is actually trying to run a division, it does pull them in directions that does not always allow them to look at things from the top and how things are operating and really be strategic. So that would be the only thing I would like to see added at some point. But I absolutely support what she's doing. I know she's discussed this with key members of her team, and I think that this does finally provide a unified approach to the Health and Human Services Agency, and so that we can start getting rid of some of these silos that we have within the agency.
Thank you.
Okay, more questions for staff? Chair Brennan, do you have any questions for staff?
No, just comments when we get to that place.
Okay. I'll look to the back. Do we have any public comment? All right, I'll bring it back to the board. Chair Brennan?
Yeah, thank you. So I think this is, I really like it. And there were a couple pieces in the conversation where, Rebecca, you talked about being proactive rather than reactive. And I think that is something that, as an organization, we have really been trying to move to, because ultimately our success, the entire organization's success, is built on our ability to do exactly that. And so I am a complete support of this. I think that you are the right leader at the right time, and I would look forward to voting on a motion when it's time.
Supervisor Rotifer.
What a breath of fresh air. You know, one of the things that I feel very strongly about is you don't organize an organization around personalities or people. You organize an organization functionally, and then you find the right people to do the jobs that have to get done. I also feel strongly that in interoperable parts, we can't fund all the backups for everybody that we need to have in the case where Section A is in crisis. okay? Section A is in crisis, Section B and C and D have to be able to help out to get them through the crisis. Just like they will be helped out when they're in crisis. I see so much of that in this reorganization. I can't say enough. This is a really important effort. I do, although I won't be here to advocate for it, but I do agree with CAO Riggs' evaluation. You have no business being a department head as well as an agency director for a couple of reasons. I know you have to because we can't afford it right now, but for a couple of reasons. One is it takes away from you being an agency director, but the other one is how do the other department heads that are competing with your department for resources, how do they feel about that? Are they really competing on an equal level? In your case, I know they are, but you're not going to be here forever. So again, you don't structure an organization around personalities. You structure it around functionalities, and you get the right people to do the right functions. So I think this is awesome, and I'll just stop there because you know the rest.
Supervisor Kirk?
Well, since you brought up finances for my little spiel, that was my question was, hey, you answered some emails offline. I had some issues about if the grants run out, but then you explained it to me how the funding was going to be there and how it was actually going to be a cost saving. So thank you for that. I'm going to go on a little bunny trail right now, but there's a constituent out there who was a pretty big critic of mine, but I think we've broken through some ice and we've had some really good conversations. One of the conversations we were having was regarding homelessness and the poor. We were going back and forth with some scriptures in Luke and Deuteronomy. And anyways, and he said something to me, we got to do something. And I'm sitting here listening to you present, and Supervisor Brennan hit on it, which was the preventative measure. And I think at the heart of it, that's where your heart is, and with the organization, I think if we can get there, and if this organization helps us get there, it's how do we prevent all those things that you discussed? Because in the long term, it benefits society so greatly. And then we don't have the poor as much. We don't have the drug addiction. We don't have all those, early childhood ACEs, all those things. So for me, I feel like this is something that I can be a part of where, so many times government gets involved with things and I don't really want to be involved with this. I'm just excited that you're on board, that you're going to do this, and we support you 100%. I told Tracy you'd be my favorite hire so far. So, so support it. The grant writer is awesome. I've learned that's a very key piece of lots of processes at play. And I think a bigger thing too, not just cost savings, but personnel savings. Hopefully it will help. Yes. We discussed at your performance eval some of the internal struggles with your people. And hopefully this will help offset some of that and implement some of those other things we discussed in the future. So I support it. And yeah, there's more to me than just financial. So thanks for bringing that up.
Yeah, and other board members have touched on a lot of the things that I wanted to mention, and so I won't cover that again. But for the public's benefit, I just want to really emphasize just how much work goes into a reorganization of an agency as large and complex as HHSA. The amount of work that it took to get here, and I remember having discussions with you, heck, like a year and a half ago, or this has been a process that's taken a long time to get here. I really think you've come back with a great plan. And one of the things that we run into often in government is we do things the way we do because that's the way it's always been done. And this, to use your term, it smashes that and pushes us just ever closer to becoming a modern, more efficient agency within the limitations of our resources. And that's the other thing I wanted to touch on is that it may seem like a dry topic to discuss reorganization like this, but what we're talking about is we are not adding additional cost to the taxpayer in the form of general fund contributions, okay? But what we're adding is efficiency. What that means is that we're creating capacity to serve more underprivileged children, more people in our community suffering from mental illness, more people who are in situations where there's food insecurity. We are opening up the ability to do more in our community without adding cost to the taxpayer, and that is a perfect example of what we are all here to do, and you've done that, I think, an exemplary job. One recommendation that I would make is that, and you did touch this, so you're aware of it, but I'll reemphasize it, that as you find ways to create capacity, you use some of that capacity and that extra staff time to fight for those grants, to write new grants, to find new funding sources, because this reorganization is something that will get us into the next 2 years, but it has to be a living organism that will change and adapt, and that we can hopefully improve the services that we have and add new ones as the community needs them. And just, to reiterate the fact that you've done all of this in the middle of a global pandemic, you've found the time to accomplish this goal that you had set out and that the board had set for you. I think really it needs to be applauded. So thank you very much for your work on this. I'll look to the board to...
Mr. Chair, I'll move to approve the staff reorganization as presented.
Second.
Okay, I have a motion from Supervisor Rotifer and a second from Supervisor Gray. Clerk, would you please read the roll?
Supervisor Sherry Brennan,
A huge yes.
Supervisor Ryan Campbell,
Yes.
Supervisor Anaya Kirk,
Yes.
Supervisor John Gray,
Yes.
Supervisor Carl Rotifer.
An emphatic yes.
All right, motion passes unanimously. We'll take a 5-minute break. We'll reconvene for our 11 o'clock appointment at 11.
I'll keep it short and wow, what wonderful, kind things. So, during these challenging times, I'm sorry, but my husband and I every morning started saying 5 things we're grateful for, and it's been really important. But I can't count the times when I've talked about what I'm grateful for. It really has been the privilege of this job and the partnerships. And I'm just going to say I won't be going far. We love this county, and we look forward to what happens next. Thank you.
And as I said before, we wish the times were different, but I really encourage members of the community, the many hundreds of friends that you've made over your career as supervisor. I encourage those folks to reach out to you in their own ways to let you know how thankful they are for your service.
They have. Thank you.
Yeah. So with that, we'll move on to our second 11 o'clock appointment. Consideration of adopting a resolution 112-20 recognizing Supervisor John Gray. So we'll start with comments from the board, then move to public comment. I'll read the resolution, and then John will let you give us any parting shots that you'd like. Supervisor Rotifer.
Yeah, I'll go first. Let Supervisor Brennan rest. John, it's been an interesting 8 years for me. I started out, and you were pretty much the elder statesman on the board. Evan and Randy had been on for 2 years and had barely found their way around the building. I didn't recognize the importance of that right away. I should have sought you out more. But as our relationship has grown, I think, I hope that you know how fondly I feel about you and how much I respect your love of this county, certainly your love of your district. But also your wisdom. And we've pretty much mostly agreed on most things. And when we didn't, I think we respected each other's opinion. But you've certainly, over 12 years, you've certainly served your district in this county exceptionally well. I've always believed that you run for election in your district, but you serve the entire county, and I got a lot of that from you because you have served this entire county. And I just want to thank you for the partnership over the last 8 years, and thank you also for your service to this county.
Supervisor Kirk.
Well, John, I'm going to miss your, a lot of times we go on bunny trails, and you always bring us back together. And I think with a new board coming on board, with all less than 2 years in, we're going to have lots of bunny trails. So I'll miss you bringing us back together. You know, when I was running for office, some people, as you know, some people love you, some people hate you. Most people who hate you have no idea who you are. But I would hear great things about you, and then I'd hear things that would make me, okay, well, we'll see. And since being on the board and being in these meetings and being in closed sessions and listening to you speak and listening to your wisdom and experience, I truly have a different perspective and a different view of you than 99% of the population does. And I think you can only get that from sitting up here and being a part of that and a lot of the closed session stuff that we've dealt with. So I'm going to miss you. If you don't mind, I might reach out to you in the days ahead because
Anytime.
things come up and you have a plethora of knowledge and a different perspective than a lot of folks have, and I really appreciate that. And I wish you all the best and the wealth, and I know you got lots of grandkids you want to go hang out with, and just God bless you, man, you and your family, and thank you for serving.
Thank you.
Thank you. Supervisor Brennan.
Yeah, thank you. I've got my composure back. So, John,
Take as much time as
I
you
think
need.
it was said earlier about your strong conviction, but you have a way of making your point very tactfully, and I have always appreciated that. I also appreciate your strong sense of family, and most importantly, at the end of the day, your love for this county and doing the right thing. And so I know we'll stay in touch in the future, and I'll look forward to that.
Thank you. Yeah, and, it goes without saying that your wisdom and dedication to this county are beyond question. I've heard, I don't think I've ever heard, even people that I know probably disagree with you, I've never heard them say anything negative or hostile toward your service on this board. I think everybody knows that you're Mr. Tuolumne County. I thought I knew a lot about this county, and talking to you, it shows me how much I don't know about its history. And at some point we'll make a little office for you, I think, at the archives, and just people can take a number when they need advice, and because we need that. This county has a rich history and understanding where we've been, and all of it. It's just so impressive to me, and like with Supervisor Brennan and also Supervisor Rotifer, I've got your phone number, so that's going to probably be a dangerous thing as we encounter the trials and tribulations ahead. Because I will, you might have to change your number because you're going to be getting asked for more advice than you probably want to provide. With that, we'll open up the public comment. Okay. Matt, do we still have Matt?
Yeah, I'm here. Could you see me?
Yep. Go ahead.
Hi there. Thank you, Supervisor. Matt Reed with Congressman McClintock's office. With remarks that have been entered into the congressional record for Supervisor John Gray's extraordinary service on the Board of Supervisors by Congressman McClintock in the House of Representatives, and I will read them here. The Congressman said, "Madam Speaker, I rise to recognize John Gray for his devoted service as a Tuolumne County Supervisor. Supervisor Gray was first elected to serve the 4th District of Tuolumne County in 2008 and has represented the people of this county and his district with passion, commitment, and integrity ever since. Supervisor Gray is well known for his many accomplishments and contributions to the community, including his leadership during an economic recession in 2008, acquiring grant funds to construct 2 community resilience centers, as well as 2 new detention facilities, and his consistent participation in fuels reduction and fire protection work. John has also been an instrumental leader for a special tax in support of Tuolumne County Ambulance in Groveland and implementing requirements of the healthcare and public safety realignments. In his 12 years of service, John Gray will be remembered by the partnerships he built, his commitment to be a good steward of taxpayer dollars, and his constant focus on improving the lives of every resident of Tuolumne County. Supervisor John Gray has truly been an asset to Tuolumne County in making it a more prosperous place for small businesses and a more desirable community for residents and visitors. It is my privilege to rise today in recognition of his distinguished public service." Thank you, Supervisor Gray, and congratulations. Thank you for your partnership and assisting constituents over the years. and everything you've done for your county. Thanks.
Thank you.
Thank you very much for those comments. I'm going to go ahead and read the resolution in full. We'll take a vote, and then if Supervisor Gray, if you'll join me at the podium, we'll present you with your resolution. Whereas in 2008, John Gray was elected District 4 Supervisor, serving the constituents of Groveland and Big Oak Flat areas, stretching as far as East Sonora and the greater Yosemite area. And whereas John has been dedicated to the people of Groveland and served on the Groveland Community Services District Board before being elected County Supervisor. And whereas Supervisor John Gray's time as supervisor has been marked by passion, commitment, and integrity to his position, as well as his constituents. And whereas John has been a leader on multiple local and regional committees and commissions, including the Tuolumne County Transportation Council, the Tuolumne County Board of Supervisors Planning Committee, the Housing Policy Committee, Commission on Aging, Tuolumne County Museum Advisory Committee, Airport Advisory Committee, Southwest Interface Team, Yosemite Gateway Partnership. And whereas Supervisor Gray's many contributions to the county during his term include leading the county through the economic recession of 2008, building relationships with Yosemite National Park superintendents and other gateway partners, building the Motherlode Regional Juvenile Detention Facility and the Sheriff J.H. Dambacher Detention Center, approving the 2018 Tuolumne County General Plan Update, leadership during the Rim Fire and other emergencies the county has faced, consistently participating in the fuels reduction and fire protection work conducted by SWIFT, and advocating for a special tax in support of Tuolumne County Ambulance in Groveland. And whereas, most notably, John helped lead Tuolumne County through some of the most difficult economic challenges in recent history, is responsible for helping to bring in millions of dollars in the county in the form of HUD grant funds to construct 2 community resiliency centers in Groveland and Tuolumne. And whereas John's multiple generations of family history in Tuolumne County have been an asset to the community and often helped inform his decisions. And whereas John Gray's 12 years as supervisor will be marked by the partnerships he built, his commitment to being a good steward of taxpayer dollars, his thorough knowledge and study of local issues, and his consistent focus on improving the lives of every resident in Tuolumne County. Therefore, be it resolved that the Tuolumne County Board of Supervisors expresses its gratitude to John Gray for his service to the residents of Tuolumne County and wishes him happiness and enjoyment with his family, and particularly his grandchildren, in the years to come. With that, I'll entertain a motion.
I move to approve the resolution for Supervisor Gray.
Second.
I have a motion by Supervisor Rotifer and a second by Supervisor Brennan. Clerk, would you please read the roll?
Supervisor Sherry Brennan?
Yes.
Supervisor Ryan Campbell?
Aye.
Supervisor Anaya Kirk?
Yes.
Supervisor John Gray?
Abstain.
Supervisor Carl Rotifer?
Enthusiastically, yes.
Motion passes unanimously.
I kind of jumped the gun earlier, and I apologize for that. But I really meant what I said. Just a few faces in this room give me joy just to see you. I'm going to miss you all. Thank you.
So we will move on to our third, another very sad, another bittersweet appointment today. Consideration of adopting Resolution 113-20 recognizing Supervisor Carl Rodefer. Again, I'll open it up to the board first and then followed by public comment, and I'll read the resolution. Do I have any comments from the board? I guess I'll start over here with Supervisor Kirk.
Okay, you sure, Carl? So I have a little bit more of a relationship with Carl, and that's because when I ran for office, this guy reached out to me, wanted to get to know me, and I thought, what the heck, I'll get to know anybody right now. I'm running for office. So we went out, we had some breakfasts, some lunches, and that started our relationship. And so I think just because of that, you know, I have a little bit better knowledge of you. And but with that also came some issues because I felt more comfortable in talking with you, Carl. We probably what I love about Carl, his military background and me working in a prison, is I can have conversations with him that I can't have with other people because other people get too offended. So whereas with him and me, we can scream at each other, we can send very nice text messages and emails, and then wake up the next day and move on. And I always appreciated that transparency. I always appreciated that we could butt heads and move on. And I think it was important for me because, well, I'll just leave it at that. Carl, I really, I'm going to miss you on this board. I'm going to miss your wealth, especially organizational wealth. Being in the military and government, you get operations and you get that. And that's a huge thing that we're going to miss at the board level. I'm thankful that I got to get to know you. I'm thankful that I got to get to know Jo a little bit. She's an amazing woman. She puts up with you. And my wife and kids also want to wish you and Jo the very best. And I know you got some fun things ahead, but you too, I will be calling you most definitely and emailing you because we're losing a lot of wealth with you three leaving. And I'm going to have questions. And so thank you, man. And I respect you.
It's shared.
Supervisor Brennan.
Yeah, thank you. So Carl and I have been partners, and Carl has dedicated his life to public service, and I think we're all aware of his history. More importantly, Carl's never been afraid to say what's on his mind. I remember sitting in the CSAC Institute for New Supervisors when Carl stood up and invited the state to come and visit our county jail. And I really think that was a huge impetus and kickoff. I know it was, in our ability to get the additional funding that we needed because those folks showed up. Carl didn't shame them into it, but he sure made a strong statement that got them here. And he did that on so many different occasions and brought so many resources to our county. So, again, I'm not saying goodbye. We'll have wine in the future.
Hopefully a lot.
Supervisor Gray.
Carl, the public sees you as having this hard edge sometimes, don't they? But I wish they knew how big a heart that you have, how much you care about about the well-being of people. You've got an ability to deeply analyze an issue quickly. You can bring things to the surface that helps the rest of the board center on what their thoughts may be. And the service to your country was phenomenal. And hope we could one day get on that golf course. We've talked about it for 8 years, but we haven't made it. So I thank you for everything that you've done for Tuolumne County, and I know you're not going anywhere for a while. Thank you, sir.
Yeah, and Carl, what do you say to somebody that's dedicated his life to protecting this country, to serving his county, to improve the lives of his neighbors and the people that we care the most about? Carl, we've served together on many committees together. I don't know if that was intentional, but I really have watched very closely your leadership skills, and you've been a real role model in a lot of ways, and I think we have very similar views on liberty and the role of government in and the ability of government to improve the lives of the people that it serves. And seeing your ability to, like John says, you have a giant heart, and being able to use that caring and that passion and turn it into action, I think is a really rare talent. And it's something that I will really miss. And again, I've got your phone number, so it's been great getting to know you and the other board members, and I think this community owes a great debt of gratitude to you, Carl, and to all of the board members for seeing us through to this moment where we have many good things on the horizon. It is always darkest before the dawn, and I just feel in my heart that there's light starting to come up above the hills. So with that, I will see if there's any public comment. Matt, are you still on with us?
Yes, Mr. Supervisor, absolutely. I wouldn't miss it. And I'm here today on behalf of Congressman McClintock, to honor and recognize the accomplishments and the service of Supervisor Carl Rodefer with an extension of remarks entered into the congressional record, which I will read to you right now. Mr. Speaker, I rise to recognize Carl Rodefer for his devoted service as a Tuolumne County Supervisor. First, however, I want to acknowledge and thank Colonel Rodefer for his years of expert advice in nominating the very best young men and women in the 4th Congressional District to our nation's service academies. Himself a graduate of the United States Air Force Academy, his personal understanding of the critical requirements of military leadership has resulted in over 100 nominees succeeding at the service academies and then as officers in our armed forces. One of these nominees, by the way, is a young man named Sean Brennan of Tuolumne County, who has a very proud aunt on the Board of Supervisors there, graduated top of his class at West Point and transferred into the Navy. Supervisor Rodefer's life is marked by public service. From his 23 years of service with the United States Air Force to his 8 years as county supervisor, Carl has served the public with dedication and selflessness. In addition to his service on a multitude of committees and commissions, Supervisor Rodefer has worked tirelessly to protect Tuolumne County's water resources, played an integral part in planning and future development of the Columbia Airport, was instrumental in acquiring grant funds to build the J.H. Dambacker Detention Center, spearheaded the county's Fire Safety and Community Resilience Initiative in 2019, and advocated for services for veterans. Carl Rodefer has been a sterling example of all that ought to be meant by the designation public servant. I am proud today to congratulate Carl on his numerous accomplishments and to thank him for nearly a quarter century of commitment, dedication, and service to the citizens of the United States and the residents of Tuolumne County. Those are entered into the congressional record, Supervisor Rodefer, and I know the Congressman had an opportunity to personally thank you over the weekend for your service as you advised him once again on a panel of distinguished veterans across the district on applicants to our service academies. And a personal thank you from me as well for the last 4 years opening up your office on the 4th floor of the county building to constituents from across Tuolumne County to meet with the Congressman's office to solve issues with federal agencies and to communicate their thoughts on national policy and national affairs. You really availed them of their First Amendment right by doing that, and so we certainly thank you. The Congressman thanks you. I know the constituents who were able to utilize that space are thankful as well. Thank you for all your service and everything you've done for our country and for Tuolumne County.
And thank you very much. We're a little misty over here, so suffice it to say, I think the board would like to convey deepest appreciation for the work that Senator McClintock is doing, Congressman McClintock is doing, and for those kind words that he's conveyed. I'll go ahead and read the resolution. We'll take a vote, and then if you'll join me at the podium. So resolution of the Board of Supervisors of the County of Tuolumne. Whereas Carl Rotifer graduated from the United States Air Force Academy in 1972 with a bachelor's in science, and then from New Mexico State University in 1980 with a master's degree in government. Whereas Carl served in the United States Air Force, retiring as a lieutenant colonel in 1995, and whereas Carl then worked as a contractor for the Department of Defense, retiring for a second time in 2002, and whereas in 2012, Carl Rotifer was elected District 5 Supervisor, serving the constituents of the Greater Columbia and Jamestown areas, as well as the entire county for 8 years. And whereas Supervisor Carl Rotifer's life is marked by public service from his 23 years of service with the United States Air Force and his 8 years of service as a county supervisor. And whereas, as a supervisor, Carl has served the residents of Tuolumne County with dedication and selflessness. And whereas Carl has worked tirelessly to protect the county's water resources, played an integral part in planning and future development of the Columbia Airport, helped lead the county during the rim fire and other emergencies in the county, and introduced the county's Fire Safety and Community Resiliency Initiative in 2019, and advocated for services for veterans. Whereas Supervisor Rotifer was instrumental in acquiring grant funds to build the Sheriff J.H. Dombacher Detention Center and worked to get the 2018 Tuolumne County General Plan update approved. And whereas Carl has been the leader on multiple local and regional committees and commissions, including Finance Committee, Tuolumne County Water Agency, Water Policy Committee, Natural Resources Committee, Planning Committee, Veterans Committee, Airport Advisory Committee, Jail Ad Hoc Committee, Local Agency Formation Commission, Amador Tuolumne Action Agency, Central Sierra Planning Council and Economic Development District, Integrated Regional Water Management Authority, Mountain Counties Water Resources Association, Association of California Water Agencies, National Association of Counties, California State Association of Counties, Finance and Administration Policy Committee, Access Tuolumne, and whereas in his 8 years as supervisor, Carl Rotifer has been a leader and a visionary. He has served the residents of Tuolumne County with his steadfast commitment and perseverance. Whereas for the third and likely final time, Supervisor Rotifer will be retiring from public service. Therefore, be it resolved that the Tuolumne County Board of Supervisors expresses its gratitude to Carl Rotifer for his service to the residents of Tuolumne County and wishes him happiness and enjoyment in the years to come. I'll entertain a motion.
Move to approve.
So, Mr. Chair, I would second the motion to commend my friend and colleague, Supervisor Carl Rotifer.
I have a motion by Supervisor Gray and a second by Chair Brennan. Clerk, would you please read the roll?
Supervisor Sherry Brennan.
Aye.
Supervisor Ryan Campbell.
Aye.
Supervisor Anaya Kirk.
Aye.
Supervisor John Gray.
Aye.
Supervisor Carl Rotifer.
Abstain.
Motion passes with 4 ayes and 1 abstention.
This is the hard part. I'll just keep it short. It's been a distinct honor and a rare privilege my wife said I'd do this anyway to serve the people of this county. Thank you.
Alrighty, so we will adjourn for lunch and we will reconvene at 1:30. Hello and welcome again. We'll reconvene the meeting of the Tuolumne County Board of Supervisors. Before we go on to our next item, I'd like to pause to remember a really significant individual in our community. His name is Mike Ayala. He served this community for many years in a variety of roles and sadly passed away recently. He was a local commander of our area California Highway Patrol post. He was the director of the Tuolumne County Chamber of Commerce, and I served with him as well as with Supervisor Gray on the county's Transportation Committee. It's a great loss to our community, and I ask for a moment of silence in memory of Mike Ayala. Thank you. Clerk, would you please read our first 1:30 appointment?
Consideration of accepting the fiscal year 2020-2021 Community Corrections Partnership Budget. And 2, presentation of the Community Corrections Partnership Fiscal Year 2019-2020 Annual Report and 2019-2020 Plan Update.
Hello.
Oh, there we go. Good afternoon, members of the board. First of all, I'm your Chief Probation Officer, Tuolumne County, but today I'm actually here as the chair of the Community Corrections Partnership for the County of Tuolumne. Let me say, first off, it's a bittersweet day, and that I know this is the last time we'll be making this presentation in front of board members Rutherford, Gray, and Brennan. You guys have all been huge advocates for our Community Corrections Partnership. First time I met Supervisor Rutherford he probably doesn't remember this, but was when he did his tour of the county jail prior to taking his entourage to the jail. They actually came out to our day reporting center program, and he had us on a very tight schedule, I'll say. That was the fastest I've ever given our presentation on how we approach community corrections in Tuolumne County. But it was a great first meeting, and it certainly helped to provide that funding for the county jail. And
May have been fast, but it was comprehensive.
Yes, we did our best. You kept us on schedule, so we appreciate that. So what we have before you today is we tried to combine some things. And first off, I'll apologize because I'm the one that's making the presentation today. In the interest of public safety, I'm going to try to cover the materials that have been prepped and prepared by our analyst. I know the information, but I'm not the best presenter, so I apologize for that. But I want to make this as meaningful for all of you as possible. So that being said, if you have any questions or if you need clarity on anything, feel free to stop us at any time. I'd like to make this as interactive and meaningful as possible. So I'll just jump right into it. I've had the pleasure of being involved in the CCP in Tuolumne County from the beginning, from its inception. I was the adult division manager when AB 109 passed, and I worked closely with Chief Adele Arnold. She was an awesome chief and worked hard towards making this a reality in our county. And we worked closely to develop our plan with all the other justice partners. So I've been involved in this process from the get-go. So what is CCP? What is AB 109? Well, in 2011, Jerry Brown, based on the need to release the overpopulation of the state prisons, it was a pretty comprehensive criminal justice reform act that, led to the realignment of state populations back to the county level in multiple tricky ways. There's the infamous non-violent, non-serious, and non-sex offenders that essentially became the county's responsibility. Of course, those categories only applied to their most recent commitment offense, not any prior offenses. So when you look at the fine details, it's more than we originally anticipated. But that being said, Tuolumne County's always had a great participation with their partners, and we've done our utmost to take this process seriously, starting with Chief Arnold. And so, what is a CCP? Well, AB 109 amended Penal Code Section 1230.1 and added in the requirement that each year we have to adopt a plan on how we're going to address this new population that's coming to us. And there was the formation of a community corrections partnership. The chief probation officer is the chair of that. And this is primarily a correctional population that we're dealing with. We're dealing with new populations in the county jail and new populations that are being released for supervision by county probation. So that's how we ended up being the chair. Most importantly, there was a realignment of funds to locals to develop this plan. And the other participating members of the CCP are the sheriff, district attorney, public defender, superior court, chief of police, and the director of behavioral health. We've always had great participation from all of those members. And we've always put together a very comprehensive plan that addressed the local needs. So the plan also requires that we utilize a process that is based on evidence-based practices, practices that have been proven to work at addressing and preventing or reducing recidivism. And we've always had our plan heavily vested in that. Examples of services that are identified in the code are day reporting centers, behavioral health treatment, electronic monitoring services, victim restitution plans, programs, counseling, work training, so on. So, as I mentioned, the two big populations, I'm just going to try to run through some of this stuff as quickly as possible so that we can get to the meat of what our plan really consists of. But we have, of course, our post-release community supervision population, which are offenders that used to be supervised by state parole, but they're now supervised by probation departments. And the next biggest population that we deal with are those offenders that used to be sentenced to state prison for felony offenses, but now they serve their terms in county jail. And they do a portion of their term in county jail, typically, and the remainder they are supervised by county probation on a term of mandatory supervision. That being said, I know when this first went into effect, there were a number of counties throughout the state, including LA County, that did not buy into the whole mandatory supervision process. where, the superior courts in a lot of counties, including LA, where they were committing offenders to serve their whole term in county jail without suspending a portion of that sentence. You could say in Tuolumne County, we've always tried to abide by, the intent of the statute and follow a process where we are giving offenders an opportunity to participate in services and get a portion of their term suspended. We've almost always had all of our offenders granted some portion of a term on mandatory supervision, which, in some counties it was always straight terms, and that was one of the things that we're tracking originally with AB 109. So it's very uncommon in Tuolumne County to ever see anyone do their full term in county jail, although it does happen. Typically, it's because the offender is completely non-cooperative and wants to serve their term, wants to have their term imposed. I will say that with this year, the biggest impact on us, although it hit us mostly in the last quarter of the fiscal year. I'm going into a review of what our plan consisted of for the previous year. Although it was that last quarter of the year, it really had a significant impact on how we did business. As we were attempting to abide by stay-at-home orders and cut back in services and do our best to keep people at home, we at the same time were dealing with state prison instituting early releases. In that first quarter, we had offenders of being released 60 to 180 days early, and they were also losing or gaining 12 weeks of service credit by not participating in services that they typically would have been given an opportunity to participate in. Basically, as COVID hit our prisons, states saw it fit to release people as quickly as possible, which put us under extreme amount of stress. Our county jail, attempted to cut back on their population so that they could safely house inmates, which resulted in a great number of offenders being released and not being held in custody when zero bail went into effect. Essentially what this amounted to was we couldn't just kind of ignore these issues. And, I salute our staff and the Sheriff's Department staff for stepping up and actively doing our best to supervise these people, including this huge onslaught of offenders that hit our county unexpectedly. So far, things have gone well. We haven't had any major issues. So I knock on wood. I think it speaks to the level of training and experience of the staff that we have, and the measures we had in place at the time. So we're continuing to address those issues, but it certainly was the thing that impacted us the most this last year. Within the last year, we also focused heavily on our pretrial release program. Every year, we're focusing our efforts as a team, as a community corrections partnership on various goals. In the last year, we spent a lot of time working on our pretrial release program, and it's a program that's geared towards reducing the numbers of offenders in custody in county jail. Typically, the county jail was running at 60 to 75% of offenders being held in custody on an offense that they hadn't been convicted of yet, the pretrial population. And so we've always actively worked, primarily because we need that space in the county jail for sentencing with these new populations that we're dealing with. And so we want to do our best to ensure community safety and improve court appearance and also protect the presumption of innocence. And so in our pretrial program, that's what we attempt to do, is we use risk assessments attempt to give those people that are booked in county jail that do not pose a risk, that can't afford to post bail, an opportunity to be released and supervised on pretrial release. We had a program that works really comprehensively with the Sheriff's Department. This past year, Sheriff's Department was actively working with probation. They would do the majority of the risk assessments in custody, and probation would handle some of the risk assessments after the facts, and also the supervision of offenders and supervision using electronic monitoring and various other things as well. So we had adopted a tool. This was part of our plan in 2018 to focus our efforts on pretrial, and it's been an ongoing effort. The last year, we were also awarded a grant, which helped to improve our pretrial program. This past year, we implemented an automated court reminder system utilizing the grant funds. So whenever an offender is on release for pretrial, they get telephone messages reminding them that they have a court appearance coming, and just like you would for a doctor's appointment. We had also started our training on implementing an improved risk assessment tool, which went into effect in 2021. And we've also switched, in 2021, we started to prepare for probation taking on the primary responsibility for all pretrial services in the county with grant funds. So that went into effect successfully, and so far so good. So just a little more about the grant program. We were awarded $587,000, well, close to $588,000 for a 2-year grant program, which also includes monies going to the county, to the Superior Court. And it pays for, in addition to increased training, a new risk assessment tool, and the automated reminder system, it pays for 2 probation staff to cover a 7-day-a-week program, which successfully went into full implementation on July 1st. Well, I guess we can go back to ours. I guess we should look at this. So, how are we doing? Well, this is a figure we provided for you previously. So here's our so far our successes versus our unsuccessful offenders in the past year. We did see an increased usage in the program. I think we've also been willing to take on and consider more releases as population pressures in the county jail warranted it. And I think our judges are very comfortable with making releases on pretrial. I think that some of the pretrial releases are in the upper ends of the risk spectrum. So they're, what we see are they're taking greater chances on offenders at a higher risk level. And as I think it's kind of the result shows that we've actually had less success this past year in terms of people not completing the program successfully versus unsuccessful. So, yeah. We also, in terms of adjusting on focusing on our pretrial program, a lot of what we did was based on the presumption that we would be looking at the passage of Prop 25 and the full implementation of SB 10. Of course, that didn't happen, but we are still hearing that there is bail reform coming, and we know there are multiple California Supreme Court opinions that are pending that may likely result in mandates that we supply some sort of risk-based supervision or pretrial services rather than a reliance on money bail. So I don't think it's putting us in a bad spot. We're still going to be dealing with pretrial in the future for sure. In terms of our CCP funding, what kind of services are provided? At probation, we supply a number of probation officer positions. We have 8 positions, not all public safety, some are support positions. We have a work release program. We have our community service program. Sheriff's Office has 7.5 positions supported with AB 109 funding, primarily all in the jail. That supports their inmate work program, their jail industry programs, and a number of correctional officer positions. It also supports GEO reentry programming services. There's a number of staff really with that as well, which also includes our day reporting center and our jail reentry program. There's money that goes directly to the district attorney and public defender, but there's additional monies that support a victim witness position, and there's behavioral health is also supported through CCP funding. So, our specific programs at probation include electronic monitoring, work release program, community service, the high-risk supervision team, and the pretrial implementation. So, electronic monitoring. We had 243 enrollments in electronic monitoring this past year. This is primarily offered as an alternative to someone being in custody. They may serve a portion of their term on EMP rather than being in county jail. They may be released from county jail on a pretrial matter with an elevated risk level and be placed on electronic monitoring. Electronic monitoring can also include continuous alcohol monitoring for offenders with an alcohol-related offense. We did see an increase in our electronic monitoring usage. Well, actually, that was a decrease. But I think I know why, but I won't go into that. So what else do we support? A work release program. Work release program is an alternative sentencing program. It's the #1 program that's used by our judges locally to as an alternative to county jail. We think it's the best program as an alternative as well, rather than serving a term in county jail. Offenders have the opportunity to go out and do work on our work release program. Mostly they serve county departments. They are often attached to and work closely with our facilities department. They do a lot of landscaping. But we have 2 work release coordinators, and they do, we estimated at minimum wage based on the number of hours that were logged, over $181,000 worth of labor performed, and like I said, on mostly county programs. We did have a temporary slowdown when COVID first hit, and we're still struggling to do this program safely. Obviously we had to cut back on the number of people that were assigned to groups. We had to implement a number of measures, but we realized that we couldn't completely suspend the program. For one, a number of our county departments really rely on the services they receive from our work release program. And 2, most offenders that are ordered to do work release are given a timeline, and we couldn't prevent them from doing their work release and leaving them in a situation where the court would have to take action or have them return back to court for a failure to complete the program. So we've reinstituted the program after a temporary delay. We never fully stopped the program. We did have 10 people that had a little bit of time left and that were able to be accommodated, but we're running back to almost full capacity as safely as we possibly can. So what kinds of things have we done? Fortunately, we have some great work release supervisors. Damon Plowman is our senior, and he is skilled and trained in concrete work, and so wherever he's had the opportunity, he's done some various projects. This last year, they poured concrete pads for ballot boxes. They did some concrete work at the pools in Twain Harte and in Columbia, and they're always doing various projects with county agencies. So, in addition to work release, we have community service program. Over 17,344 hours were completed at locally registered nonprofit organizations, and we make sure that we refer them. We give them a list of providers that are available. They can also seek out their own, and then we verify that they complete their hours for the court. But again, another alternative to custody program, typically reserved for lower risk people, but another great service provided by CCP. So our high-risk supervision team, it's a nice picture of our team there. It's probably one of the best things that I've seen in our county with CCP, and it's been from the inception really to have this team of probation officers and sheriff's deputies working together every day, assigned to various activities. They have a great we have a great working relationship with the sheriff's office, and so how does it work? Well, all of the offenders that we have, we work on a risk-based system. We do various risk assessments, and those that are at the highest risk, we pay the greatest attention to, and we want to be very responsive to their potential to commit new crimes. I should say that we also offer them a lot of services, including DRC. They're all required to participate in services, and the high-risk team works to get offenders placed and dealt with. We had this year, we were helping people get to hotel rooms, get to treatment programs, but we are also out there responding when they aren't complying with their services, when they aren't showing up, and making sure that that they know we're following up on them, and that often leads to new arrests or new criminal activity that's uncovered. This past year, we had a number of 290. Our high-risk team also handles our sex offender population. We've had some offenders that required a lot of assistance in getting to their programming, and we make sure that they make it there. We were involved in 16 separate arrests for drug sales. We've also recovered firearms, ammunition, and stolen property this past year. It seems to be every year. We also assist by linking them with our behavioral health clinician to services and supports. Our clinician works closely with that team. I think that one of the best things we added was we started a multidisciplinary team meeting prior to release, even when the offenders are in state prison. We work to identify needs and services to help them be successful. We're able to give them a full range of expectations and also assist them in any way we possibly can when they are released. So it's that works closely with our assigned counselor to that team. But we've also interceded in domestic violence situations, and we've, on more than one occasion this year, we've had to place minors into protective custody and work closely with child welfare services due to situations out in the field. So, happens.
Hello, my name is Shauna Kurzich. I'm the supervisor for the Adult Supervision Unit, and I am a member of the High-Risk Supervision Team. And our team is the same as it was last year, although this year we have a new member, James Pedro, who is finishing the end of his field training program, and we're super happy to have him. The biggest impact for us this year has been COVID-19, the restrictions. Early on, our office shut down and field, probation checks were suspended. We are out in the field again, but early on, this really impacted the supervision of people and getting out in the field and seeing them, which is vital to what we do. As Sheila mentioned, CDCR inmates are being released early, up to 6 months. And early on, this created just a huge impact on our caseload numbers, dealing with those that have mental health needs. Sheila is vital in that and helping us see that their needs are met. Because our team continues to make home compliance checks a priority in this community, in the last year we have made multiple arrests for drug sales, drug possession, and stolen property. We also made arrests for felons in possession of firearms and ammunition. During home checks, we have found children that were in very dangerous living situations, unhealthy living situations, and together with CWS, these children were removed from the home. And part of supervising offenders that lose their children is getting to see them through that process of reuniting with their children, doing the hard work, the programming through DDC. And that's an awesome thing to see when people turn their life around and get their kids back. And so I thank the board for your continued support of what our field team does on a daily basis, and thank you.
That was Shauna Kurzich, our supervising probation officer, that leads the probation side of the team. So next we've got some demographics, some snapshots. Some of this is pulled from data that we have to report, but it's if there's any questions about this, you can see the impact of Prop 47 for one thing on the felony probation population. And I believe it was Supervisor Rutherford last year who mentioned that the increased risk of the offenders we're dealing with, which is absolutely the case. Before the advent of Prop 47 and even AB 109, we had many more low-risk offenders that we were working with that didn't require the same level of interventions and oversight. And since AB 109 and Prop 47, the risk level of our offenders has really become pronounced. It's, we pretty much, over 2/3 of our offenders are in the high moderate range. So it's, it's required that we be more attentive and responsive, and also to pay attention to their willingness and level of engagement with their treatment services. Another statistic that we track annually, it may or may not be instructive. It's kind of a rainbow. And I know that it looks like a little bit of a mess, but what I think this does show is what the statewide average is for failures on community supervision, and where we fall, which is typically below the statewide average. And we also took a smattering of similar-sized counties, and I think one thing that I see in this is that we are fairly stable in terms of how we have done over the years. Our failure rate tends to be on the lower end of the state average, and it's consistent. And I think that as we've seen increased risk of offenders, I think that that's important to make note of, the fact that we're continuing to see similar results with increased risk. Anyways, so our Sheriff's Department is another one of our great partners in the CCP, and some of the services that are supported by AB 109 are jail staff and trainings. We have the male inmate work crew and the female inmate work crew program, and a number of positions that fall within that. Let's see, here's a snapshot of 36% of our AB 109 offenders participated in service programs in the county jail. Then they have a breakdown of the others as well. I will say our sheriff's inmate work program is a great program. It's I think the first time I met Sheriff Pooley was in 2014 when he came to Chief Arnold and me and pitched his idea of creating that program as part of our local CCP program, and I must say I was impressed, and I will say that he's certainly followed through with all of the things he said it would provide. I'll go ahead and advance. So they do more than just have inmates dig holes. This isn't just a punishment. It's an opportunity to provide some vocational skills and training to our inmates while they're in custody. It's definitely helped to reduce recidivism and promote positive inmate behavior. To be a part of that program, they have to abide by a higher level of conduct within the facility, and they see it as a privilege, and they do have privileges and rewards that come their way when they participate in that program. We've seen a total of 363 inmates participate in that program. They've tracked their own recidivism within that program. They've only seen 20% of those offenders that participated in the program return back to custody in Tuolumne County, which is a great rate. I will say also that there's many more services that they've been able to expand and provide as Sheriff Pooley's team has worked to secure contracts with other governmental agencies in order to expand what they do, and some of the other important things they provided are the jail industry program and also Highway 108 Fire Safe Council growth reduction. This last year, or the last 2 years actually, in their program they started a nursery where they were able to grow plants and then do the landscaping for our new dam packer detention facility. So you could see the fruits of their work out there currently at that new facility, and it looks really good. Other things they've done are trash removal from the highways. They've also have goats that they manage and maintain to help eliminate the weeds in the Jamestown landfill. And they've done some brush clearing in conjunction with the National Forest, and they've done work in this past year at the Atka Food Bank as well. Another big partner in our plan is GEO. They provide all of our offender reentry services, and everything they do under the format of as an evidence-based program. Very efficient and effective. Their main program is a moral recognition therapy program. It's a 3-phase program as part of the DRC. They also have various other programming they do, individual cognitive behavioral therapy. They have journaling, parenting classes, substance abuse treatment. They do drug testing with offenders in conjunction with probation. They also work to develop job skills with offenders and help to refer them out. In order to successfully complete the program, offenders must get a job or be attending school full time, and they prep them for that. So we've had a great number of successes with our GEO Day Reporting Center program. They also provide. Let's see. This past year we had a drive-by graduation. Usually they have a very elaborate graduation ceremony. This year we had a drive-by graduation. So not quite the same thing, but they had nice gift baskets and it was well attended. We had probation staff and jail staff out there congratulating our our participants on their successful completion of the program. And it was actually a very nice event. We have a clip here from
My name is Amanda, and I successfully completed the GEO program in 2018. When I first got to the program, I was a little confused about myself, of who I was, and about life. But the staff at GEO program quickly taught me so many valuable things and great tools to use in my everyday life. I learned exactly who I was and how to accept that and love myself. I learned how to set healthy boundaries. They taught me how to communicate. I was able to gain employment. I was kept accountable. I was also able to enroll in college courses so that I could further my career in drug and alcohol counseling. The program helped me become and stay a productive member of society. Today I'm trusted. I currently work at Maynard's Treatment Facility with people who are just like me that I can relate to. And I get to help them to achieve and maintain sobriety through the support system that they offer. I am so grateful for the opportunity to have done the GEO reentry program. It has truly helped me get to where I am today, and I am forever grateful for that.
Hi, my name is Lisa. I went through the GEO program and graduated in 2017. While I was in GEO, they helped me to learn how to stay sober, how to have confidence in myself, which then led to a career for me, a new way of life is really what they taught me. I also went through the construction apprenticeship program, and when I graduated that, I got a job through that program. I worked for George Reed out of Modesto. I started in 2017 as an apprentice. I went through the apprenticeship program in 2 years. I graduated that and became a journeyman. And then in March of 2019, I was called into the office, and now I work in dispatch. If it wasn't for GEO helping me to gain the self-confidence that I needed, I don't think I would have the job I have today. I feel very lucky that I was able to go through that program, and I still use tools that they gave me in that program today to help me with my everyday life.
My name is Amanda.
Hi, my name is...
So here's the stats on our DRC program progress or successes. Although it may be a little bit baffling, I guess, that we have so many more unsuccessfuls than successful. I will say that it's an extremely challenging program, and nobody completes the program in less than 210 days. So it's demanding, and it's a multi-phase program. Also, some of the things that may throw these stats off is that although you can only be counted as a success once for completing the program successfully, this is by the number of referrals. So we have sometimes people that fail the program multiple times, even within the same year. But we keep insisting that they go back and they complete the program. And so the other category are those who either transfer out, who may not for an unsuccessful reason, but they are closed out. We often have people that are struggling with an addiction, drug and alcohol problem that we decide that they're better served by going into a rehab program, and so then we'll close them out as other in that category. But it's not uncommon to have people fail multiple times before they actually get it right. And we never stop trying with them. We want to give them the skills and ability to be successful. And our program is rigorous. And I think it just means that those who are successful really can take pride in their commitment and accomplishment. Let's see. So I guess that covers that, I guess. And in addition to our day treatment program, we also have a jail reentry program. It's not quite as rigorous, but it is a good introduction to those who are willing and interested and want to participate. It gives them a good grounding and will help them be successful if they move on to the Day Reporting Center program. Provides the same level of evidence-based practices, but it's a voluntary program, so typically we get people that are really motivated in being successful. And the criteria for successful and unsuccessful isn't quite as rigorous. To be successful, they have to complete 50% of the programming and be in good standing when they leave the program. That's because oftentimes people can participate at various stages of their process, and so they may be released from custody, they may be sentenced to state prison and go to state prison. You know, they may get out of jail early. They don't have to fully complete the program to be considered successful. But I will say anyone that is supervised by us that is released locally, if they are halfway through the program, then they immediately go into the DRC program. And typically we see greater success with those who have started in the jail reentry program. Next, we have our district attorney's office that's supported with AB 109. I will say early on, as one of the flaws in AB 109, it was brought out that by our district attorney that there was nothing in AB 109 that required or specified services for victims of crime. And I would say that that was, you know, a negligent part of the original inception of the plan. And, you know, with any serious crime, you're going to have victims that need services. And it's very important that we have victim witness advocates that support victims in our local community. And we work closely with the DA's office. Whenever we need anything, they're very attentive to providing intervention services for victims, and they do a great job. So we're glad to say they're a part of our local plan. There's some stats there, yeah. Let me just move on. Okay. So our district attorneys provided some statistical information on what her staff has had to deal with in terms of our offenders. You can see that their workload is significant considering this population. The PRCS, they did a total of 111 PRCS hearings, which is quite a bit. 7 of those were contested, which required a full trial of the allegations. And then they had 129 mandatory supervision violation hearings, which was an increase from the previous year, pretty substantially. I don't know what to make of that. Moving on, our behavioral health department. We have a full-time clinician that's assigned to the probation department. Half of that position is funded by AB 109. Sheila Redowdy, our clinician, does a fantastic job. She's led our charge in developing and instituting a multidisciplinary team. She works with probation officers when we have pending releases coming. She'll go to the jail and work with the offenders while they're in custody and start to work on a discharge plan with them, making sure they have the support and services they need. We do Zoom meetings or online meetings with CDCR inmates that are coming our way to create plans and make sure that their needs are attended to. She also works closely with any of our mentally ill offenders that need those additional supports and services. She does a great job. I think we have a clip from her, with her as well.
Good afternoon. I am Sheila Redowdy. I am the clinician from behavioral health that's co-located in probation. I would like to say thank you to probation from the leadership of Chief Dan Hawks and Division Manager Joelle Kewish, to the probation officers and the support staff. They have provided guidance and help whenever I've needed it and helped support what I do. On average, I'm seeing about 20 to 25 clients a week. This includes arranging and participating in multidisciplinary team meetings with clients to help clarify their probation requirements, identify barriers that they have to meeting their requirements, and increasing agency within the client. The MDT meetings include the probation officers, myself, other community agencies that are involved with the client, and anyone else identified that the client would like at the meetings. I've been seeing clients at the jail for most of the year, but due to COVID, it's on a limited basis and mostly at the attorney booth. I have been seeing clients identified by probation that they would like me to see, clients on AB 109, and newly released, early released COVID clients. Several of these individuals have had immediate needs due to coexisting medical issues, mental health issues, combined with not having enough of the basics to live. These individuals were provided housing, mental health services, primary care providers when indicated. In some instances, several clients released on AB 109 have been able to have video conferences prior to their release. This has enabled us to have services such as food, clothing, and temporary housing ready to meet their needs for a smoother transition into the community. Engagement and meeting a client where they are at is a key element. Also, it's not just me or probation that makes a difference, but interagency support and support from the nonprofit agencies in the community that help the individual find their way back into the community and increase their sense of well-being. If I were able to have one of the clients here today who've received services this past year, I would have, speaking to you today, an older individual who was released on AB 109 with no housing, disconnected from their family, had mental health needs, medical needs, no housing, food, or clothing. This individual was able to benefit from temporary housing initially, and then move to more stable housing through funds from AB 109 and reconnecting with their family. This individual received immediate clothing needs from Interfaith. The individual is now receiving mental health services, medical services, and assistance from the benefit resource person at the Enrichment Center. I would be remiss if I did not mention the support from the person in the SB 82 role, Betsy Coe, who has worked to help stabilize individuals that are currently on felony probation and newly released AB 109 individuals. I thank her for all of her help and support.
So, what's changed, or what are we looking at for the next year moving forward? So one thing that the Board of State Community Corrections has asked us to do, and which we've actually done ourselves, sometimes I feel like we're kind of one step ahead because we've done this all along. As far as I know, we update our plan, and we're constantly looking at developing new ways to expand our services or address local needs. And like I said, the pretrial program was something that was brought on as a program that was needed, and then we also had our jail inmate program, and we always entertain suggestions within the CCP, ideas, ways to improve our system. But just in the last couple of years, BSCC has asked us to start updating or sending them our updates and providing a breakdown on what our new goals are and whether we have accomplished our goals. And it's fine with us because it's stuff we've already been doing. But I will say that our mental health competency program is an ongoing targeted program goal. That this was a suggestion of the sheriff and district attorney. And the reason this is important is we have offenders who are often stuck waiting in local county jail when they meet the criteria under 1368 that they're not competent to stand trial. It's typically a serious mental health issue that requires that they go to the state hospital before they can move forward and restored to competency. Just getting into the state hospital often takes 6 to 9 months for our offenders. And the county jail is not an ideal place for anyone with a serious mental health disorder to be, or a place to be. So what we would like to do is try to develop a local program so we can start providing those services while we're waiting for a bed to open up at the state hospital level. We continue to work on that goal. Another suggestion we had for a goal to include this year was to expand our electronic monitoring home detention program and look at streamlining the process, potentially utilizing it more to a larger degree with, we've never done involuntary commitments to electronic monitoring, and this was a recommendation that stemmed from a request from our public defender's office. They thought this would be a good opportunity to help reduce jail population, especially with the lower risk of jail inmates. I will say the one hindrance that we've had with adopting or pursuing that goal is that the state did pass AB 1869, which eliminated the collection of criminal fees for offenders, and our electronic monitoring program services has always been partially supplemented by offenders who can't afford to pay, and any extension of the program without having that support from offenders is really something that we are reluctant to fully move forward with. But we're still looking at it. It's still a goal of ours to try to expand it if possible. So our progress towards our ongoing goals, as I mentioned, the sheriff's office and the DA wanted to pursue a jail-based competency restoration program. We're exploring that possibility, possibly partnering with Calaveras County to have a 10-bed program, make it cost-effective, and that would help expedite any of our mentally incompetent offenders through the legal system process and minimize the amount of time they're spending in custody. We're still exploring that possibility. It's important, so we're sticking with that one. We're still working on our electronic monitoring goal, although I'd say that we're a little bit less enthusiastic about it now that we know we're losing revenues from offenders to support it. Now I will turn it over to our business manager, Amy Arndt, so she can talk to you specifically about where we're at budget-wise and give you a rundown on how we're doing.
Okay, hi. Just trying to give you some visuals at how CCP funding comes in and how much we've been receiving and how this year is looking different. So public safety realignment is part of the overall 2011 realignment. You've probably heard about a number of times. And it funds the CCP amongst other public safety programs, or at least in part funds them with sales tax and vehicle licensing fees. And so this graph over here on the left shows you the CCP base funding in blue, and then the growth funding to the right for the past 5 years, and then what was estimated most recently in June. That's our most recent estimate, so that's what I'm kind of operating on for projecting the 2021 revenue. However, I just ran the account activity for what's been coming in the first we've received, I think, the first 4 months of funding, and it's looking a lot better so far. Since it is based on sales tax, I mean, it's hard to project what that will look like, but I think you've seen or been hearing how the sales tax wasn't as dismal as projected so far. Don't know, what to expect necessarily for the future with businesses remaining closed, but so what was most recently projected was that we would be receiving no growth funding and a bit lower base funding as well. So yeah, like I just mentioned, unlike previous years, there's likely to be no growth allocation. And that was basically, it was due to state level decisions about what they were projecting the COVID-19 impacts to be. I haven't heard anything new about growth funding. I think that might be gone. The state did provide some realignment backfill. That went into our general fund, not directly to the CCP, because the realignment, the backfill that they provided was kind of general in nature, and it was meant for multiple programs. But there is an impact there. Our growth has ranged over the past 5 years from about 123 and on up to 676,000. Usually it's in the $150,000 range. So, with a lower base and the loss of growth funding, it will mean a reduction in our operating trust fund. By how much, I don't know exactly. It just depends on how that sales tax continues to come in. But if it does, if the total we receive for fiscal year 2021 is close to what they projected, and we do spend at, I'll get into our proposed expenses, but if we do receive what they last projected and we do spend what we are proposing to spend, it will result in a draw from the trust, whereas over the past years we've been building the trust, which is great because it's allowed us to kind of weather the storm. But so just looking at those projected revenues, so for this year we're looking at just under $2 million coming in into our trust funds, whereas last year it was close to $1 million more than that. Last year was kind of an anomaly, though. We received really high growth funding, if you remember, because we had a really high probation success rate in a year where the statewide rate was really low. So that growth funding is based on what comes in, but also our performance, in community corrections, how well we're doing. So we had a really good last year, and a lot of that is still in trust. So that it's very helpful for a year like this to come at this time. But we are looking. We haven't seen a year, if it is as low as they're saying, since about 2014-15. So getting into expenses, when things started to get really crazy and we weren't sure what was going on, we were waiting for guidance from the state. And at that time, then former Chief Downey, who's since retired, she approached the CCP Executive Committee about, we were looking at what we had in trust and kind of making some projections. And she had proposed, what if we at least started the year at a status quo level, kind of preserving our positions and continuing on until we knew a little bit more. And then since then, the CCP has met multiple times and moved forward with kind of a status quo funding request, which the executive committee did approve. Even at that, the status quo funding level, it's still looking like it's probably going to be close to $100,000 less than our actual budget for 2019 and 20. And some of the reasons for that were we do have county furloughs, and so that's kind of will lead to some decreased claiming for staffing. And then also in probation, our former senior work release coordinator had retired, and we haven't filled that position yet. We're working on it, but there's a vacancy there, so that's leading to some salary savings. And then last year, probation was approved for some multi-year funding to alleviate some of those barriers like Sheila was talking about for people who are vetted by the multidisciplinary treatment team and who really need the services, can benefit from them for a limited amount of time to help them get over the hump and move towards self-sufficiency. So she's been very frugal with that, working with families, working with providers to make sure it's affordable. So I think that funding is going to last us a long time. I budget for the whole $150,000, but we're using it very slowly. So I think it's going to be last us a while. So with that, we have a total proposed budget of just over $2.6 million. There's a graph or a pie chart on the right that tells you where we spend it. I mean, just like any program with staff attached to it, that's where the most expenses are. Beyond that, professional services make up about a quarter of that. Most of that goes to our GEO reentry programming at the day reporting center and in the jail. And then there's a little bit made up of, supplies, equipment they need, training costs and such.
I will say also that Chief Downey, her first year as the chair of the CCP, she took on a big a challenge because we were at that point overspending. When you look at what our budgeted plan was versus our revenues at that time, we had to do some belt tightening as a group and agree to make some cuts to our plan and we also agreed to have a minimum reserve in our trust of $400,000 to help cover situations like we are seeing now with, reduced revenues with the COVID-19. It should allow us, based on the fact that we did build up a healthy trust reserve that, largely came about because Chief Downey, her guidance in that way, I think it was a huge factor in us being okay at this current point.
So some kind of the bottom line that I'm seeing right now for our fiscal year 2021 budget is, healthy allocations over the past several fiscal years have helped out a lot, having significantly higher than normal growth last year, and also kind of shifting away for some costs that had been borne under AB 109 have been shifted to that time-limited grant, the pretrial grant. And then, the conservative spending by the funded departments like Dan was just mentioning, I think those are helping us weather this storm for this year. And so I'll run through these really quickly. So basically, under the proposed budget, this is kind of what the funded departments would be spending it on. Continued support in the behavioral health department for the clinician, Sheila Redowdy, who's embedded in probation. That funds half of her time. They also kind of dialed back their housing residential substance abuse treatment line item because of the funding to probation. It was kind of really working through the treatment team, facilitating that and utilizing that money as effectively as possible, so they didn't need to ask for as much. They provide real limited funding for recovery counselor services as well. In the district attorney's office, there is a full-time victim witness advocate that's assigned to AB 109 clients. They are also funding part-time criminal division attorney to work on those post-release community service and mandatory supervision cases. And then there's a little bit of funding in there to partially fund a senior office assistant for the overall department, burden associated with AB 109. And then in probation, we're continuing our funding at 2019-20, or really 18-19 levels. We haven't made significant changes since then. And in just some updates, in October 2019, we began utilizing those awarded grant funds to enhance our pretrial program. And so some of that has been shifted away and doesn't need to be supported by AB 109, but yet we can still form a more comprehensive program. And then in July 2020, I had alluded to the $150,000 that were approved, but that's, I think, going to prove to really go a long way in terms of helping people who really can use that. And then kind of our shared contractor, GEO Reentry Services, it does provide continued funding for them to provide their programming for in-custody and out-of-custody individuals. And the Sheriff's Office is also continuing their, continuing to operate at levels seen in last year and in years past too. They haven't made a lot of changes in time. There's also funding in there proposed for one-time startup costs for 5 jail deputy positions at the new jail. That was approved last fiscal year, but it was not spent. So that's still in there for them to utilize as they go online. And then other one-time implementation and training, there's some funding in there for them to make sure that their staff are, meeting BSC standards at the new jail.
Yeah, Just to summarize, you know, I touched on it a little bit initially, but you know, COVID-19, the pandemic really has been our biggest challenge, and we're in the middle of it. And I you know, just to kind of hopefully draw this point home, you know, typically we have a jail that houses 147 inmates. We knew that that was, you know, insufficient, and that's why we have a new jail that's coming online. But, you know, currently we reduced that to 105 total inmates due to COVID-19 to have safe housing of inmates there. So we're, you know, we have that many fewer beds. When you take into account that we have 48 prisoners currently inmates sentenced to CDCR that are in the jail awaiting to be accepted to prison. One way that CDCR has addressed their COVID-19 issue is by basically shutting down all intakes on new inmates. And so as of right now, we have 48 people. They stopped taking intakes in March. We don't know when they're going to resume, but of our 105 beds that we have 48 of them that are held by people that should be in state prison. So really, we're working with a very limited number of beds, which is a big challenge to our local criminal justice system. I know that there's numerous challenges. In addition to the inmates waiting to be accepted to CDCR, we have 5 jail inmates that currently are meet the 1368 designation, and they're waiting to be accepted into Napa State Hospital. So, and there's also significant lag times with acceptance to the state hospital. So right now, I mean, it's, you know, I don't want to be negative about the state, but essentially they're managing their COVID situation by basically inmate releases, which impact us locally, and not taking new inmates that they should have housed in state prison. So once again, you know, it's local county corrections that are having to deal with the state's you know, adoption of a plan to deal with COVID. It's something that can't continue to persist, especially if we, you know, until we have it. We'll obviously be doing a lot better once we have our new jail open. But in the short term, it's caused a significant amount of stress on our jail correctional officers and our deputy probation officers and our local law enforcement. We're trying to manage this population the best we can, given the fact that we're working with, you know, a handful of beds at our local jail to manage offenders. And anyways, that's where I leave things. This is COVID-19 has been a significant factor for us this year, and it will continue to be so. I just wanted to end with that and let you guys know where we were, and I'll take any questions if you guys have.
I do have one. Lots of detail here, a lot to comprehend. But back on slide 41, under the district attorney, it was page 21. You touched on the 65% increase in the previous year on missed hearings. Have we identified what that problem is, or how can we make it better?
No, you know, we all report our...
I see the district attorney's here. Maybe she can help.
Yeah, that would be great if she could give us some insight, because she probably has an explanation for us. I didn't know she was here.
Thank you. A couple things come to mind. One, which was previously mentioned, is that we calculate every time one of those hearings is scheduled, and because of the delays and the continuances as a result of COVID, a lot of times we appear and the court has instituted emergency orders that come from the Chief Justice. So our cases will get set out 30 days. And so then we reappear, and sometimes the orders are renewed by the Chief Justice and we get further continuances. And sometimes they often need time to meet with their attorney, the offenders. And so they will show up to the court appearance, and they'll need a week or two to have a meeting to decide whether they're going to contest it or admit the violations. That results in another hearing. But we do know also, in addition to the issues that COVID has presented in the criminal justice arena, that in certain areas, and as some of those slides show, we're having more people, for whatever reason, and again, it probably comes back to frustrations of being associated with COVID, that are violating probation, PRCS, and so when they violate their supervision requirements, it results in a violation being filed and us appearing at those hearings. And I think what we're seeing, not just locally, but also statewide, is a whole host of frustrations, and frustrations often pan out with people acting out on their frustrations, which causes violations. And so I think it's a combination of all of those factors.
Thank you.
It'll be interesting to
Makes
see what
sense.
next year.
Yeah.
Thank you.
Thank you.
Thank you.
Yeah, I think that we have definitely seen a spike in probation violations as well. Not tracked here, but we've seen the same thing. So I think what she's saying is absolutely correct. We have people that are stressed, and they're they're dealing with the same pressures that we have, and that's why we try to be responsive, and we've increased violations. Unfortunately, when there's no room in the county jail, it limits our options. I mean, we at one point we did temporarily suspend our GO services, but we realized that we couldn't do that, and that we were getting an influx of people released that needed to have those services. So we found a way to make that work. Currently, we just recently implemented using Microsoft Teams to do most of the group rehabilitation meetings, but they're still doing individual meetings. We're trying to do it as safely as we possibly can, but it really is, it's a challenge. And we have seen increased violations and acting out, so.
Thank you.
Any other questions?
Other questions from the board?
Yeah, I should have asked you this earlier, Chief Hawk. Sorry if I'm not clear, but earlier you guys were talking about the pilot program, the bail, and there's a 60 to 75% waiting on court proceedings. Is that because those are the more high violent offenders that we're not able to do?
Well, so the
Yeah,
biggest issue is that it's that they can't bail out. They don't have the funds to bail out. So
okay.
If they don't have the funds to bail out, then they'll stay in custody. Now we've tried to target that, and we did have some success in lowering that average. But since COVID's hit, I don't know that we are. I think we've gone higher than probably. We were closer to 50% at one point in time. I think we're now probably back up to 75% if we're looking at that.
So it comes down to the unable to fund the bail.
And unable for them to bail out and them being too high of a risk. You're right. It is their risk that would necessitate keeping them in.
Okay. So. I know. Sorry. Yeah, it was a lot of information. It's interesting seeing it from this perspective, working in the prison, because there's been a few times we've gone through a few waves where we know they're all sitting at the jails and the court proceedings, and then we get flooded, and then they close the pipeline back up, and so this is just an interesting perspective, and it's a mess, but time will sort it out. So
we hope there's a light at the end of the tunnel.
Yeah.
Just checking in, Chairwoman Brennan.
No question.
Okay.
Thank you for the presentation.
Thank you. And the only thing we do need is we are asking for the acceptance of the adopted CCP plan for 2021, and we would appreciate your support in that. Okay. We just need a vote on that.
I'll look to see. Okay, we do have some public comment, so at this time we'll open the item for public comment.
Hello, can you hear me?
Yes, we can hear you.
Hi, my name is Heather Smith. I'm the program manager for GEO Reentry Services. I wanted to say thank you to the board for taking the time to listen to this presentation and giving us your consideration. But I also wanted to give you guys the opportunity to ask me any questions you had specifically related to GEO Reentry and what we do for the community.
Okay, I'm looking around. All right. Well, I don't see any questions, but thank you very much for your comments.
Okay,
Okay, looking to see.
thank you.
Thank you. Looking to see if we have any more public comment. Okay, no public comment, so we'll close that. I'm looking to see if there are any questions or if we'd like to have a motion.
Do we need a motion to
Yeah.
accept it?
So he's looking for a motion on
Okay, I
the.
move to accept.
I will second that. Thank you.
So I have a motion from Supervisor Rotifer, second from Supervisor Gray. Ms. Ryan, would you please read the roll call?
Supervisor Sherry Brennan,
Aye.
Supervisor Ryan Campbell,
Aye.
Supervisor Anaya Kirk,
Aye.
Supervisor John Gray,
Aye.
Supervisor Carl
Aye.
Rotifer.
Okay, so
Thank you very
motion
much.
approved unanimously. Thank you very much. Second to switch gears here. So our second, so clerk, would you please read our second 1:30 appointment?
Public hearing to consider Forg's appeal. 1, conditional use permit CUP 20-005 to allow the development of a new 80-foot tall, 80-foot tall wireless communications tower and related equipment within a fenced area around the base of the tower. The project site is a 14.6 acre parcel zoned RE-5 MX, residential estate, 5 acre minimum, mobile home exclusion combining under Title 17 of the Tuolumne County Ordinance Code, located at 5456 Valley Verde in the community of LaGrange, assessor's parcel number 073-030-003. Number 2, indemnification agreement by and between Tuolumne County and Jesse Forgs and or Cal.net.
All right. Thank you very much for that. Do we need another minute to set up here? Okay.
The project land use technician for conditional use permit 20-005. The applicant is Cal.net.
I don't think you're going over the mic.
Should I start again? Okay. My name is Terrell Turner, and I'm the project land use technician for conditional use permit 20-005. The applicant is Cal.net. Conditional use permit 20-005 to allow the development of a new 80-foot tall wireless communication tower and related equipment to provide wireless internet service within a service gap area. The project is located at 5456 Valley Verde in LaGrange, approximately 1,950 feet northwest of the intersection of Fuente de Flores and Valley Verde. Assessor's parcel number 073-030-003. The project site is a 14.6 acre parcel zoned RE5 MX with a general plan land use designation of rural residential. Within the RE5 zoning district, a wireless tower is an appropriate development and is a permitted land use with a use permit. The site plan shows the proposed tower location on the project site. Section 17.53.090 of the Tuolumne County Ordinance Code requires that major wireless communication facilities shall be set back at least 110% of any communications tower height from all property boundaries. The proposed tower would be located approximately 30 feet from the eastern boundary, which would not meet the required 110% setback of 88 feet. The remaining setback distances to all other parcel boundaries sufficiently meet the requirements. The proposed, Section 17.53.100 states that the tower shall be granted in a location otherwise not permitted if it complies with the service gap requirements. So the proposed project was found to meet the service gap requirement. Although the tower would not meet the 110% setback, a variance is not required. The proposed tower may be approved in the currently proposed location. The elevation diagram shows the proposed lattice tower, the proposed lattice design of the tower. Section 17.53.120A5 does not require that a wireless communication facility be designed as a stealth facility or otherwise blend with the surrounding landscape if evidence is submitted to and accepted by the decision-making body and a finding is made that locating it on a less visible site is infeasible. A California Public Utilities Commission grant has provided CalNet with the funding to provide unserved areas in Tuolumne County with high-speed internet. The grant limits construction to a lattice design due to the lower cost versus a monopole tower with a stealth design. A lattice design allows for light and background landscape to be viewed through the lattice features, whereas a monopole design obscures the view as it is thicker and wider. The lattice design is not structurally able to handle the stealth features such as tree branches. The lattice design also allows the towers to be easily climbed by technicians. Staff is in support of the proposed lattice design. Concerning alternative site analysis, the proposed project site was ultimately chosen because the location is in an area with sufficient line of sight to be able to serve the area identified by the CPUC. This view is a visual simulation of the tower looking north toward the site from approximately 1/2 mile away. This view is looking west toward the site. And this is the view looking north toward the site. 18 adjoining property owners were notified via mail in March of 2020. A total of 3 response letters were received, each in opposition with concerns. The response letters indicated 3 areas of concern. The first being health and safety regarding radiation. The applicant submitted an electromagnetic energy exposure known as an EME compliance report. The report is compliant with the FCC standards. Additionally, the applicant has indicated that their towers would emit less energy than typical cell towers. Second item of concern, impact on property values. An impact to property value would be considered an economic impact. Section 15064E of the California Environmental Quality Act states that economic and social changes resulting from a project shall not be treated as significant effects on the environment. Third, visual impact. A lattice design allows for light and background landscape to be viewed through the lattice features. In contrast, a monopole design obscures the view of the landscape due to the larger size. The towers utilized by Cal.net are much thinner than a monopole and are therefore less visible and blend into the landscape or sky at a distance. On October 27, 2020, at a specially scheduled meeting, the Tuolumne County Planning Commission approved the proposed project. On November 5th, 2020, an appeal of the Tuolumne County Planning Commission approval of conditional use permit CUP 20-005 was filed by Conifer Communications pursuant to Tuolumne County Ordinance Code Section 17.68.130. Conifer Communications cited setbacks and service gap, as well as alternative site analysis and co-locations as reasons for their appeal. The applicant's and staff's response can be found in the Board of Supervisors memo. Here are the required findings of the conditional use permit. Evidence and the staff's response to each point can be found in the agenda report. The Tuolumne County Board of Supervisors may either approve the project with conditions, approve the project with modifications, or deny the project. Are there any questions from the board members?
Questions from the board?
I'll wait also.
I just had one clarifying question. Could you move back to the slide from the Planning Commission meeting on the 27th of October? Was there a no vote?
No, there was a commission member that was not in attendance. Oh, there was one, yeah, that one no vote.
Well, because I think you might have to, in the minutes, there weren't any, it was all ayes with one absent.
Oh, okay.
So I think it should
Then
just
it might have been
it
a
should be
typo.
601, I think.
Mm-hmm.
Okay.
Yeah.
All right, I was just a little confused by that.
Okay.
And that was my only question. Okay, so at this time, we will, the applicant and the appellant will receive 15 minutes to speak on this item, after which time we will go into a public hearing to allow the public to comment on this as well. So we will start with the applicant, I believe.
Information and evidence to support the planning commission's approval. There's I guess there's two different ones. You're going to take them separately, but what I have to say just kind of is going to be the same for both. We started working on this project in 2014, and in 2015. October 2015, or actually March, we actually submitted the application, and it was conditionally approved by the CPUC, but then there were some challenges to it. And the CPUC went back, looked at the timely challenges, that there were a couple of them that were timely and one that was not timely. It was a late filed challenge from Conifer, but they looked at it anyway, reviewed some of the areas that were considered unserved and had determined that there were some that were served by a couple of other areas, and they removed those from the grant, removed those households from it, and then redid it. The grant approval services were provided to areas that the CPUC and through FCC filings and everything else is determined that were unserved as of the date of the grant approval. We estimate that there are somewhere in excess of 400 homes in the area of the two towers that are being questioned. We by no means expect to be able to get 400 customers, but because of the technology that we utilize, it's line of sight. Some will be able to see it, some won't. But we can pick up quite a few customers that probably don't have any service at this point in time. Throughout the entire county, there's probably 4,000 households that this will cover. This year in particular has shown us how critical infrastructure for internet is, and reliable internet, and maybe not just one, but multiple providers to be able to get to the households and stuff for school and people working from home, vacation rentals, all those type of things. Before I go a little further, just want to make it clear what we do. Cal.net is not a carrier. We're not a cell phone company. We don't provide cell services. The systems that we put up are point to multi-point, meaning that it serves just a particular home at a time. Somebody that subscribes, we look to see if they have access, and if they do, then we can get them an installation. We don't build huge monopole towers with that look like trees that, by my estimation, don't look like any tree that grows in our communities. So they're kind of an eyesore just because of that fact. We use a lot less intrusive steel lattice towers that actually do not attract the eye. The eye looks through them. So it gives you, even when you look at it, most people don't even notice that they're there. Sometimes they notice them right away, but then they forget that it's there because it just disappears into the surrounding areas. As I said before, this process began in 2015 through a series of meetings that we had with the supervisors in 6 different counties, including yours. All of those supervisors at the time were 100%, for something to help the county get that, and that's where then we moved to proceed in applying for a CASF, which is California Advanced Services Fund grant. That's a reimbursable grant. They don't give us the money to do it. We build everything out of our own pocket and then have to apply to get reimbursed for up to 60% of our expenses. The information that we used in preparing the grant utilized information provided by the CPUC for unserved census block areas. It was also areas that were provided by the FCC with their 477 filings, which is the requirement that everybody has to provide so that they know basically where you say you can provide services to. This grant was originally granted and approved with a resolution from the CPUC on December 15th, 2016. And at that point in time, this is where there were some timely challenges filed and one late file challenge by Conifer on April 27, 2015, prior to the December approval, that were all taken into consideration and reviewed by Communications Division and a decision handed down, and that's why they approved it. At that point in time, like I say, they actually removed several census blocks that they found that were justified because they were being served, and they took those away. But once they made that decision, it closed the time on changing what was served and wasn't served. So when the CPUC passed down the resolution and approved it, it basically became frozen in time until the grant's completed, because they can't go back every 2 months or 3 months or 6 months and see if something's served or unserved. So it became a grant to provide those unserved areas at the time. And that's what we started to move forward to do. And then it went before in December 15, 2017, 2 years later, Conifer submitted an application for modification of the grant. In its challenge, Conifer stated that it currently served businesses and consumers in the area, and that the CPUC looked into it again. And basically the comment from the Communications Division of the CPUC said that the application for modification raises issues which constitute no more than an attempt to relitigate matters that were already decided in the resolution. At that time, the census blocks for the unserved areas were effectively frozen in time until the completions of the project. And at that time, this decision was not challenged again until now. I'm looking at different things and stuff that we can do and that we have done. And Wayne will go into this a little bit more detail, but in providing services to specific unserved census blocks, you're very limited to where you can put a site to be able to hit them. We don't live in flatland. We don't live in farmland where the trees are only 20 feet tall. We live in the Sierra Nevada mountain range where there's mountains and 150-foot trees in between. So to be able to hit a specific site with a line of sight technology can be very difficult. And that's what we had to deal with in putting this together. I think at this time, I can probably pass this over to Wayne so he can give you a little bit more information on how he arrived at some of these locations too.
Can you all hear me just fine?
Yeah, we can hear you. Go ahead, Wayne.
Thank you. Thank you, Madam Chair and Supervisors. I would like to take a little bit of time to explain to you our process for site selection on this project, which is also relevant to our other 5 county projects. I'll speak to the Forges site at first, and then I have additional remarks that are kind of dissimilar for the other site that's on the schedule. For all our sites, we must engineer and build a redundant high availability network where one doesn't currently exist. There are numerous criteria that we need to be able to successfully deploy new services to meet the needs of the CPUC and to earn buy-in from our county partners. Each site has unique challenges to overcome. Our design ensures that if a tower temporarily is out of service, that all other service areas within that network are not interrupted. The engineering we are employing uses an interconnection of towers, and the redundant features allow other sites to remain operational if by chance there is a failure at a single site. The design for this project will have the capacity to provide the 99% operational uptime required by the CPUC to Tuolumne County residents and businesses. The features of this new, reliable design are not available today by any other provider in the county. In order to provide the service I just discussed, it is important to locate sites that will provide the service delivery and redundancy necessary to meet the objectives of the grant. When we first look for new tower sites, we must take into consideration how each site will interconnect with the others. That by itself will eliminate many alternative sites. Once we find a good site and contact the owner, many times that doesn't work out, so we move to the next alternative site. At some point, we identify an owner who is willing to partner with us, and that becomes the primary site. The 2 sites in appeal today are part of a much larger project the CPUC has mandated CalNet to execute. These sites must be able to provide a reliable download and upload capabilities to be consistent with the desires of the CPUC. The Forges site that we're discussing today is uniquely situated to help us achieve the 99% operational uptime reliability required by the CPUC. Originally, we were not going to serve the community to the northeast, but a homesteading couple purchased the land on the hill above the community about the time we were looking for replacement sites. As required by the county, we provided it on alternative analysis to the primary candidate. The 2 were previous candidate sites that did not work out. The first site was located above an abandoned mine, and the property investor felt that was too much of a liability having it there. This site was substandard, but it was the best we had available at the time. The second property, we could not come to appropriate terms and agree to a location on the property that would achieve the goals of the grant. We abandoned that effort after meeting the Forges family because their property exceeded the abilities of any other in the area to serve the market below. This concludes my remarks on this property.
Okay, are there any more comments from the appellant? Or I'm sorry, the applicant?
I don't believe so at this time.
I don't believe so. Yeah.
Okay. So I will look to the board to see if there are any questions for the applicant. Okay.
I have just one quick question. Somebody said 400 homes and then 7,000. How many homes was this going to reach out to? Is it 7,000? I thought I saw on a graph.
So in the area where these 2 towers are that are being appealed, there's about 400 homes. Not all of them are in line of sight, but the entire area represents about 400 homes. Typically on a site, if we do a good job, we might get 10% of the available homes, maybe 15%, some areas a little bit higher. But the service is there in case they need to switch or their T-Mobile or something isn't working right and it's available. The 4,000 homes is for the entire county that are in areas that are unserved currently, that we will be able to build out sites and stuff like that that can feed those particular areas.
I do have a question.
Mm-hmm.
Your service, when it's in place, you would have X number of people there, but would it preclude another company coming in and putting in a tower to, say, collect more customers?
I don't understand the question.
Okay.
I'm sorry.
You have a tower put in, and it's a service tower. Would your
Right.
tower being in place preclude a competitor from coming in and putting in a tower of his own?
I think, as I spoke earlier, most of the towers that we build are not designed for heavy weight. We typically will co-locate equipment with emergency services and first responder, because a lot of their equipment is fairly light and doesn't affect the tower capabilities. These are not built to co-locate with a carrier whose equipment is extremely heavy, has a lot of wind load that require the towers to be much more robust to be able to do that. So we have never been adverse to sharing if the engineers and the tower have the capability to be able to do it, but we would never jeopardize the structural integrity of a tower by putting something else on there that wouldn't work.
All right, thank you.
Mm-hmm.
Okay, any other questions for the applicant? Okay, at this time we will allow 15 minutes for the appellant to comment on this project. And do we have Sonia? Are you there, Sonia? So I'll just take a minute for us to get the appellant set up in the right room. Are you there, Sonia? Can see you, but we cannot hear you.
Can you hear me now?
Can hear you now, loud and clear. Okay,
Thank
so
you.
you'll have 15 minutes to speak on this item, and then we'll move into to open the public hearing.
Thank you very much for taking an opportunity to discuss this afternoon. Our concern comes down to the proper use permit and following the rules of that permit process. In this, the applicant asked for a variance on the setback, 30 feet instead of the 108 feet, which would be 110% of the tower height. They did so under two conditions. Under one condition, primarily being that they would fill a gap in service. Now, I understand that the resolution that gave them the funds to get reimbursed to build such a tower were set according to 2014 data. And that may freeze by the CPUC. However, that doesn't necessarily freeze what happens in the rest of the world. And in those 6 years, that area is no longer considered unserved or underserved. That data is covered by my company, Conifer Communications. We're also a fixed wireless service provider. We do line of sight, multi-point, and have high redundancy using a network of towers to cover the area. One such tower is on a public structure there, a company building, and that covers that area. It also comes to the second point in that the applicant is required to do co-location analysis on any of the sites. They did do analysis on alternate sites, but they did no analysis on co-location sites. And that's why we feel this exemption should not have been approved, because they did not meet the requirements for the variance. The first being that the gap in service, the data used was 6 years old, and that the co-location work was not done. One of the things they spoke of was the increased competition this could bring. That is also not a valid reason for a variance to be issued. And just because the CPUC froze their data in place in 2014 for that resolution T17502C, when these funds were given, that does not mean that the county must hold to those terms, especially when it wasn't disclosed in the application. And one final point, this is Don Pedro area. We're talking LaGrange. There are not a great deal of 100-foot trees all around. There are a lot of hills and knolls and creative ways to cover this area, which our company has done in those last 6 years.
Okay, thank you. Are there any questions from the board for Ms. Harris-Langen?
It's just coming to mind. We're talking about unserved folks out there. So is Conifer Communications currently serving those folks, or is
We are.
Okay.
Ryan, if you look at the challenge report that I submitted to the staff, there are maps showing our coverage of that area in compared to the coverage the applicant was proposing with their new tower, and it shows that we are currently covering that space.
I do have one question.
I think I had a question from Supervisor Brennan. Is that correct?
Yeah, thank you. I did. It's on this co-location, and because I think that is a piece that's important down there, and I'm not understanding why. Sounds like it wasn't really analyzed, and that's co-location for emergency calls, and a lot of that area does not have good cell connectivity, and it sounds like that was not analyzed as part of this.
From my reading of the application, there is no mention of co-location analysis. Staff would need to confirm.
Okay. Supervisor Gray, I think you had a question.
Just curiosity, how many customers do you have down in the Don Pedro area approximately?
In the whole of the Don Pedro area?
Yeah, just approximate. That would service the same area that these cell towers are.
So this we have currently served by one tower, and we have, I believe, roughly anywhere from 30 to 60 customers on that tower. I would have to check our data to give you a more secure number.
That's close enough. Thank you.
Okay, any other questions for the appellant? All right, thank you very much for your time.
Thank you.
At this time, we will open this matter for a public hearing. Looking toward the back if we have any comments from the public. Okay, I see that we do not have any comments, so we will close the public hearing and I'll bring it back to the board. Do we have any additional questions or comments for staff?
Yeah, because there are some allegations that things were not done that may have been done. But my first question would be, have we given a setback variance for cell location in the past?
Quincy Yaley, Community Development Department Director. Yes, we have. In the past, we have utilized an actual true variance entitlement if we've had a tower that didn't meet the setback requirement. If that tower met a service gap exemption, in the past we had also still required a variance entitlement along with that, but when we received these 15 or so applications from Cal.net, we reconsulted with County Council, and at that time we're given direction that because of the service gap exemption, which is explained in the staff report, that an additional variance in the true sense of variance entitlement was not necessary. So they were great, because of the service gap, they are allowed to be less than 110% of the tower height closer to an adjoining property line.
Okay, and the next question has to do with the length of time between when CalNet received their grant. What was it, 2014, or I can't remember the date, I'm sorry. And looking at the service that was there now, they received a grant based on what was then. And do we have any power that we could say that we can't consider this because it wasn't based on today's versus yesterday's model?
So again, in the past, we have utilized the funding source is not a part of our consideration, with the except that the funding is based on providing internet or in the other situations cell service to census block areas. And so other projects have come before us, and we have used that the grant program as the reason why we are proclaiming it to be a service gap, is that it's either receiving some sort of federal or state funding that another program outside of Tuolumne County has identified this area as being underserved or not served at all in the past. So we consider that data for that reason. With respect to co-locating or a tower nearby, the nearest tower, I believe, is over 3/4 of a mile away. And when we're talking about direct line of sight, things of that nature, pursuant to the response from cal.net, that's not close enough for them to co-locate and still meet the purpose of the grant. The appellant indicated they served 40 homes or so. It appears that the cal.net tower will serve a broader area with more homes, and so for that reason, they also don't necessarily exactly overlap, and we feel that the service gap is appropriate.
Okay, thank you.
Okay, you kind of addressed it, but I'm not sure you did. My concern goes to whether that area is adequately served or not in reality. I understand that who's the grant agency? I'm sorry. CPUC. I understand that the CPUC doesn't want to redo their data every day, and that they're willing to give the grant money to do the tower. I get that. But my question goes to, is that area in reality underserved today? Because it brings in, the answer to that question brings into the dialogue the discussion of unfair competition, okay? Because a service provider has made the investment of their own money into providing the service that's out there, and now someone comes along that provides competition with government funds. That's not fair competition. So that's my concern, is what is the actual coverage that is out there today? And am I willing to give someone an unfair competitive advantage when they've already got the area covered? Not only that, but CalNet could use that grant money somewhere else in our county where there isn't coverage. There was a question embedded in there.
What would you like me to respond to?
Well, I don't know. Do you understand my concern?
Sure. And, the service gap provision in our ordinance code does not have a clear definition. And so we've typically used these state and federal grant programs as evidence for our evaluation purposes to say there is a service gap.
And absent any other competing evidence, I'm willing to take that. But we have an allegation here that is contrary to that years-old analysis. And what I'm asking is, have we, has the appellant provided any information that that gap actually does not exist? Or have we made any effort to see if the gap actually does exist?
We've made, I'm not trying to be coy, I'm trying to figure out how to answer your question, Supervisor. We have the information that's been provided by the appellant in response to this appeal, and that's what we're presenting to your board today. They were required to include coverage maps as a part of their application, and we feel that the project does meet the findings under the ordinance code to recommend approval to your board.
Okay, but I don't have to approve everything that meets something under the ordinance code.
It's a recommendation.
Okay, I can't approve it if it doesn't meet it, but
It's a staff recommendation, and that's all it is.
Okay.
Quick question.
Yes, Supervisor Brennan.
So under the terms of the grant, are they supposed to evaluate for co-location with potential cell carriers, or is it just with other internet providers?
Supervisor Brennan, we do not we only use the grant to support the information, the assertion that there's a service gap. Other requirements of the grant in terms of them meeting those requirements is not under our purview. So maybe I'm not understanding your question as it's related to the CPUC grant. The source of the funding is outside the scope of the ordinance code's evaluation.
Okay.
Okay, other questions? The one thing, okay, so you kind of already answered it, but I'm just going to put a bullet point next to it. So we come up with this issue about the 110% variance for the height of the tower. It's come up more than once. And it sounds like what you're saying is that we have in the past approved variances of less than 110% of the height in the past, correct?
That's correct.
But even that fact notwithstanding, the service gap information here, whether or not we had approved these types of variances in the past, the service gap data allows us to approve projects of less than 110% anyway. That's another.
As long as the tower meets all the other provisions of code, which is what ordinance says, then the service gap allows a tower to be approved either in a zoning district that it might not be permitted in, within a setback that it might be required to obtain. So when the ordinance was drafted and approved, it basically gave a tower a way to go through a process if it was fulfilling a definition of a service gap, which historically we have used if a program is being funded by a grant. We've had federal, telecommunication grants come before your board, or the Planning Commission. Those grants are funded based on underserved census block data, and that's what we have used to support the fact that the staff is making a recommendation that there's a service gap.
Okay. So that's the one thing is the setback. The other is the service gap itself. That was the other issue that's been talked about. So it sounds like the service area for this particular tower will be beyond what the actual service gap has identified. Is that correct? Or include areas that are within and without of the scope of the service gap?
I don't think I have the ability to share my screen, but in the application and in the packets, there are maps that are available,
right,
that show the extent of the proposed project. And as the appellant stated, they also submitted some maps, and the CPUC grant information, which is in your board packet, also has maps in it regarding service areas.
I guess what I'm getting at is, so more people than just what is identified within the service gap could receive service from this tower?
That might be a question for the applicant.
Okay. Okay, any other questions for staff? So look to council, can we bring the applicant and or the appellate back?
If your board has questions of the applicant or the appellant, I believe you can ask those questions, yes.
Okay, so will we ask the questions of each or direct the question at the pertinent group?
I would recommend giving, if you ask a question of one, giving the other an opportunity to respond, just to make sure that they each have a fair opportunity to.
Okay, so if the applicant is available, that would be my question for them is what does the area of service for this particular tower cover beyond the identified service gap? And then we'll give the appellant an opportunity to respond as well, correct? Okay.
Yeah, I'll take this one.
All right.
This is Wayne Collins. Yes, the service gap that is identified, our towers will reach somewhere in the realm of 6 miles. It is beyond the gap that's there. There's properties that are underserved. They just don't have enough bandwidth available to them at their service from their service provider currently. That'll also be additionally affected by this. We've looked at this pretty thoroughly, and we've looked at every commercial tower in the area, and additionally to this, so we know where the service gaps are already, and these towers were placed because those towers do not achieve the goals that we need to achieve.
Okay. And then do we have the appellant to respond to that?
This is Mark. I just want to answer a couple questions that I heard earlier or comments. One of the questions was...
Mark,
yes.
I'd like to give the appellant the opportunity to respond to the previous question before we move on, if that's okay.
Go ahead.
Thank you.
You're the appellant.
Sonia, are you there?
I apologize. It looks like it takes some time for it to rejoin and make me the presenter. But yes, this would cover a greater area. The tower proposed would cover a 6-mile radius that is currently covered by our tower and others in the area.
Okay. All right. Any other questions?
Yes, I do. I would like to ask the appellant, and then obviously the applicant can chime in afterwards. But again, my issue is this area already covered that they're going to put a tower at? Is it adequately covered in your view, or does it need additional coverage?
I would suggest going back to the CPUC to view their current maps and to get that definition, to have an objective third party in this regard. And when you look at those maps, it does not show as unserved currently. It shows some underserved, one census block in which our tower is exactly located in the middle of, but it does not show as unserved. And that's the current CPUC broadband maps that can be found online right now.
Okay, and then the applicant, do you have any comments on my question as well?
Can you hear me, sir?
Yeah.
Oh, go ahead, Mark.
Okay. Yeah, I do have a comment on that, and it kind of goes along with what I wanted to mention a little earlier. You had one of the supervisors had asked a question: if we don't put a tower up there, can the money be used in another location in the county? The answer is no. It is specifically stated for census blocks, and if you don't provide a service in that census block, then you have to basically give the money back, even though we haven't received it. You take it away from any future earnings. And if you understand the technologies involved here, Sonia herself said they have one tower that feeds this area. If you understand what shading and all that kind of stuff is, from a point to multi-point system, there could be a small hill in the way that would prevent them from hitting a customer on the other side of a hill, a little knoll or a tree. Having an additional tower on the other side could probably hit those. So it's not like you can put something up that's going to burn through all the trees and get to everybody out there. It's a very line of sight technology. It is just that. It's line of sight. You can have some leaves and some trees in the way, but if there's too much, it breaks it down. So I would say that the area is not fully served. If they've got 30, 40, or 50 people on a tower, I don't know what the total number is in the area, but that's not everybody. And people deserve a choice. That's what I've got.
Okay,
all right, I'd like to also add a little bit to this. We still receive calls, and we have received calls for a while, but every time I drive a company car into that area, we get calls for service. They think that we're out there. Just the area, it is not all houses are reached by the providers that are there, and the providers that are there are not always getting the job done.
Okay.
So we are very aware of what is available to us down there, and we're just waiting to be able to have this facility completed to take care of those future consumers.
Okay, thank you. I have a question from Supervisor Kirk.
Yeah, Sonia, does Conifer Communications have plans in the future to expand out in that area? Has there been any?
Absolutely. And we don't have a problem with competition. We have a problem with asking for variances based upon inaccurate data. It's absolutely correct that there are census blocks that they need to serve with this grant. But as they said, there are many ways of doing that with line of sight. And just because right now they're choosing to go with one tower that requires these changes in the rules, that does not mean they can't put up multiple towers that stay within the rules and cover that area in the same way. That's how we operate, and that's how we would expect everyone else in the county to operate.
All right, sorry, and then I had one more piece of that question. Is CalNet's pursuing of these towers, has it inhibited Conifer Communications from providing more services in that area?
Is there pursuit of putting? I'm
So
sorry, I didn't understand the question.
Sorry, my first question is: are you guys planning on expanding? And if you are, perhaps why haven't you? And is that because of Conifer's, or is that because of CalNet's possible acquisition of this tower?
We are expanding. We definitely have some things in the pipeline right now that Quincy could speak to on that issue, but all of them fall in those. This going forward does not change our plans for that tower. We just feel that we all should be playing by the same rules.
Okay, I'm going to bring it back to the matter at hand, which is the approval of this Cal.net tower. Do we have any other questions for staff? Any other comments on this?
Yes, I do.
Okay.
My concern is not whether CalNet ought to get the funding for this, grant funding for this. That's not my concern. My concern really isn't whether we ought to, whether it meets the waiver criteria or not. My concern is fairness of competition. Cal.net is getting grant funding to put in a tower that's going to compete with a local business that is using their own investment monies out there. Put that tower up that exists out there. They're going to put more towers up. It's fairness of competition, and that's my issue. And that's, I'll stop right there.
Chairman Campbell, if I could just address briefly the board, I think I want to help the board refocus the inquiry is whether the findings for denial are supported or the findings for approval are supported, or whether the board needs more information. I don't think these questions about fair competition are necessarily relevant to those findings. There's been a lot of back and forth about
and I agree with you there.
Competition, so I just wanted to note that as far as the record goes.
I guess what I'm looking at is
So,
we have a set of rules in place, and did the applicant follow the rules that we set for them in this application process? Would you say that's accurate to what we're talking about?
Yes, I would say that's accurate. And one of the considerations that the court needs to consider, if whether or not this project is consistent with the ordinance code, is whether that service gap exception is met, whether the applicant has demonstrated that the facility would be necessary to fill an existing significant gap in the ability of remote users to access the applicant's communication services.
Supervisor Gray?
yeah, thank you. The issue on the service gap is that question based on when the analysis was done by CalNet. But the issue of the conditional use permit variance is something that I think we can address. We have done variances before. If that variance is similar to what we have made a decision on, I have no problem going forward with the variance. The question, again, is trying to decide the service gap issue. And that might be something that we might want to address, and I see Quincy's just getting ready to go with it. Go ahead.
Supervisor Gray, if the Board of Supervisors doesn't feel that the project meets a service gap requirement, then they should send the project back to staff and encourage the applicant to apply for a variance. The applicant can apply for a variance, and they can make their submit information as to how their project meets the required findings for a variance. They have complied with all of the provisions of our ordinance code. They've submitted the information. Staff feels that in practice with the past applications we have processed and that have been approved by either the Planning Commission or on appeal to your board, that this project meets the service gap requirement. However, if your board doesn't feel that way, then that would require them to meet all of the other provisions of the ordinance code, including a setback. If they can't meet a setback, then they can apply for a variance under Chapter 1768.
Okay, I'm gonna just ask a yes or. Oop, turn my mic off. Have we done sufficient? Has sufficient current analysis been done to determine if there is a service gap out there, in staff's opinion?
In staff's opinion, we have done with this, we have treated this project as we have treated every other project that has come through the door with respect to the required amount of information that we would use in order to determine if there's a service gap.
Okay.
Any other comments on that? Okay. Yeah, the matter that we're talking about is we set out a series of hoops for this applicant to jump through. And did they jump through the hoops? And what we're hearing from staff is that they did. So I have a hard time coming back to any applicant and telling them to redo the process by changing the goalposts and asking them to redo this process when that could have been made clear to them before they got to this point and invested the time and energy in getting this far in the process. You know, the idea of fairness has been brought up, and I see that in part as a fairness issue, that we need to hold each project to similar standards. And if we've offered variances in the past of similar, and we do have evidence that staff agrees there is a service gap there, I don't see, other than something that's not reflected in the information provided to us, which I don't have any evidence that there is any such information. I don't see anything that would preclude moving forward on this project. So with that, I'll look to see if there's a motion.
Well, since it's quiet, I agree. There's some I'm not gonna say personal. There's some issues at hand which Supervisor Campbell spoke to, but they've gone through the process, and yes, I will leave it at that. John, you have something to say?
Okay, so getting back to the findings, the issue of the setback, in my opinion, we've covered that. The service gap, there's not 100% clarity because we have two differing opinions on it. But based on the information that staff has given us and the backup information, it appears that there is a service gap. And if there is a service gap, then the CalNet has covered that within the information that they've provided. So I understand there, but looking at what we have to do here, I'm going to have to. I could go ahead and move, and if there's a second or not, it's or a substitute. That's fine with me. That we approve a conditional use permit CUP 20-005 based upon findings A through G.
And I'll second.
And conditions 1 through 35.
Yes, and conditions 1 through 35, sorry.
Okay. So I had and then you seconded? Okay. Any other comments? Okay. So I have a motion by Supervisor Gray and a second by Supervisor Kirk. Clerk, would you please read the roll?
Supervisor Sherry Brennan?
No.
Supervisor Ryan Campbell?
Aye.
Supervisor Anaya Kirk?
Aye.
Supervisor John Gray?
Aye.
Supervisor Carl Rodefer?
No.
Okay, so we have 3 ayes and 1 no, or I'm sorry, and 2 noes. And this is not a 4/5 vote, correct? Okay, so the motion is passed. Okay. Moving on to our 1:30 appointment. Yes, so we're going to take a 10-minute break. We'll reconvene at Okay, so it's 4:02. Reconvene the meeting of the Tuolumne County Board of Supervisors. And so we're moving on to our third 1:30 appointment. Clerk, would you please read our third 1:30 appointment?
Public hearing to consider fees appeal.
Okay, let's just pause for a second to, we have some audiovisual issues, so we'll take another 2-minute break.
Good afternoon.
Hold on just 1 second. We're going to go another 20 seconds.
Whoop.
No, just hold on. We'll start over. Okay, we'll try that one more time. We'll reconvene the meeting of the Tuolumne County Board of Supervisors. Moving on to our third 1:30 appointment. Clerk, would you please read our next appointment?
Public hearing to consider D's appeal. Item 1, conditional use permit CUP 20-003 to allow the development of a new 70-foot tall wireless communications tower and related equipment within a 12 by 12-foot fenced area around the base of the tower. The project site is a 79.6 acre parcel zoned AE-37 AIR, exclusive agricultural, 37 acre minimum airport combining under Title 17 of the Tuolumne County Ordinance Code, located at 13700 Clements Road in the community of Groveland. Assessor's parcel number 066-010-072. Item 2, indemnification agreement by and between Tuolumne County and Johnny Lee Dees or CalNet.
Thank you. So we have our Community Development Director.
Good early evening. Quincy Yaley, Community Development Director.
Hello again.
The project before you is CUP 20-003 and the applicant is Cal.net. This is CUP 20-003 to consider development of a new 70-foot wireless communications tower and related equipment to provide wireless internet service within a, as well as to have a 12 by 12-foot fenced area around the base of the tower for equipment. The project's located at 13700 Clements Road in the community of Groveland, approximately half a mile from the intersection of Clements Road and Ferretti. Assessor's parcel number 66-01072. The project site is just over 79 acres and is zoned exclusive agricultural, 37 acre minimum airport combining with a general plan land use designation of ag. Within the AE 37 zoning district, the wireless tower is a permitted land use in conjunction with a use permit. Here you have a map of the project site outlined in black. The tower is located along the southern property line. Again, and some additional mapping of the project showing you its distance from the property line. On the southern side, approximately 43 feet. Section 1753-100 and allows a tower can be granted in a location otherwise not allowed if it's necessary to comply with the law or fill a significant gap in service. This tower is would typically be required to be set back at least 110% of the height from all property boundaries. The tower meets these setbacks with the exception of the southern property line where it's 43 feet from the southern property boundary. So the proposed tower meets all other provisions in ordinance code with the exception of the southern property boundary setback. Therefore, it can be found to be allowed if it complies with the service gap provision. No variance is needed if a project meets the service gap provision. As we've received direction from County Council, in the past we have required a service variance historically prior to 2020. But now with this new direction, if it meets all the provisions of the wireless ordinance code, but still does not meet a setback or is located on a property that's not zoned for it, if it does meet a service gap exemption, it can still be considered for approval. This is an elevation of the proposed design of the tower. It's proposed to be a lattice design. Section 1753-120A5 does not require that a wireless communication facility be designed as stealth or otherwise blend with the surrounding landscape if evidence is submitted to and accepted by the decision-making body and a finding is made that locating it on a less visible site is infeasible. A CPUC grant has provided Cal.net with the funding to provide unserved areas in Tuolumne County with high-speed internet. The grant limits construction to a lattice design because the cost to utilize a monopole tower with stealth design can be much higher than a lattice tower, and therefore fewer towers could be constructed, which would not meet the requirements and goals of the grant. The lattice design, however, for our consideration, does allow for light and background landscape to be viewed through it, whereas a monopole design does obscure the view as it's thicker and wider. Stealth towers that mimic trees require large monopole structures to handle the weight of the branches or other stealth design features. A lattice design is not structurally able to handle these features. They're much thinner than a monopole and are less visible and blend with the landscape or the sky at a distance and are able to have a reduced height. The proposed site was ultimately chosen because it's located in an area that has sufficient line of sight to serve in this area that is identified in the grant as underserved. Therefore, the staff supports the proposed lattice design. This is an elevation of the tower looking east towards the site. And here is another aerial of the proposed tower here in the center of the photo. We did notify 42 adjoining property owners by mail. In March, we received 5 response letters, 2 neutral and 3 opposing. 1 letter raised concerns about safety and radiation, and the applicant did submit an electromagnetic energy exposure known as an EME compliance report, and the project does comply with FCC standards. The project was sent to the Agricultural Advisory Committee on September 17th, and they did make a motion to recommend approval of the project to the Planning Commission. On October 27th, at a specially scheduled meeting, the Tuolumne County Planning Commission approved the project with a vote of 6-0. And then we did receive an appeal regarding this project from Conifer Communications, citing the reasons for their appeal were setbacks and the service gap, as well as the alternative site and co-location analysis. The staff's responses to these can be found in the board memo. Cal.net did provide us with a list of alternative towers that the project should have considered. 2 of those towers we were unable to identify in our building permit tracking system. The other 2, one was permitted under CUP 17-010, was 1.6 miles from the proposed tower site. CUP 17-020 was 1.4 miles from the proposed project site, and therefore they would not meet the needs of this project. The findings for the CUP are before you, with additional finding if the board approves the design not to be stealth. The Tuolumne County Board of Supervisors may either approve the project with conditions, with modifications, deny the project, or send the project back to staff. Are there any questions?
Questions from the board?
Real quick, you just said a minute ago 2 towers could have been used. One was 1.6, one was 1.4 miles from the project site. When you say could have been used but couldn't because they're outside the project site, is that per the CPUC guidelines or the CalNet zone that they were supposed to abide by? I mean, could you expound on that a little bit?
So it was these towers, according to Cal.net, could not be used for co-locating because they would not have met the required area to be served by their grants for these or underserved areas in this project area.
The service gap that couldn't be reached with those other towers.
Correct, because these towers are a line of sight, require line of sight. Moving them to a certain degree out of the line of sight of another connecting tower makes it prohibitive for that to be used for that provider.
Okay, thank you.
Other questions for staff? I had one question. So if you go to the picture of the proposed tower, I believe that one. What's that building there?
It's a single-family residence.
That's a garage that's got some really nice cars in it.
Okay, so that...
On the property.
Right, so in the far distance, there's a home, and then that little building right there is a garage. It's not is it attached to a residence, or?
I don't know.
Okay.
The residence, you see the paved area down below where the garage is. Mm-hmm. The residence is to the left of that paved area, and it's hidden by the trees. You can see the roof line sticking up.
Right.
up through it.
So that rectangular building is not directly adjacent to the residence. The only residence in that area is that one that's kind of in the distance near the paved area, right?
Correct.
Okay. All right, that was my only question. Okay, so seeing no more questions from the board, at this time, we will allow the applicant to speak for 15 minutes on this item, after which time we will allow the appellant to speak for 15 minutes. Then we will enter a public hearing. So we will allow the applicant to speak for 15 minutes if they are available.
I don't think I have 15 minutes to talk because nothing really changes as far as the history and everything of the grant. A couple of things that I do want to bring up is that we probably would have been building these towers 2 years ago if it wasn't for all the appeals and delays that have happened through the CPUC and everything else through this process. The other thing is I'm looking at current maps from the FCC, and that just to put this one to bed, within under 5 miles of this particular tower, there's no less than 100 homes that are unserved currently, according to the FCC data a little over a year ago when they published their data for the Connect America Fund. Now that only takes it to the Mariposa County border, and I know you don't care about going over the line, but you go half a mile over the line, there's another 50 homes. Not counting the ones that are possibly underserved, and from looking at the maps, and it's been years since I was up there, there's literally hundreds of homes around there. So I don't really have anything else to say to bring that up. Wayne, do you?
Yeah, I do. I'd like to add to kind of our process on this Dees property and give some background to the area. The Dees property provides half of our wireless ingress redundancy to the Groveland community. This is an essential site to achieve the reliability required by the CPUC. The area, as Mark pointed out, is still considered underserved, and the whole Groveland area is really vastly underserved at this point. The service quality in the community has degraded drastically since the beginning of the pandemic, and the community needs new service providers in the area badly because what is available is failing them. We looked into alternative locations required by Tuolumne County Ordinance Code that would fill the goals of the grant. The other properties did not have power close enough to the highest points and other features that make this much better for us to build these sites and to achieve our service delivery goals. I also just want to add before concluding on this that I've been called in to that market by a large number of businesses to have meetings and also some of the agencies in the area, because as of the beginning of the COVID situation and the response to it, their service has fallen flat in the area. A lot of people can't even make Zoom calls out of that market right now, depending on what provider they have. And it's not one specific provider. They're all falling flat. So they need, and we're even talking the big guys are not serving their customers' needs. So there's a need in that area that's quite large. Anyways, that's pretty much the conclusion of what I had to say. Thank you.
Okay, any questions from the board for the applicant? Sherry, just checking in on you. Any questions?
No.
Okay. All right, so at this time we'll move to the appellant. Sonia, you'll have 15 minutes to respond if you wish.
So our argument is similar to the last review in that the service gap has not been met. If you look at the current CPUC map that is up on the website, and I'd be happy to share my screen, it does show that area as being served. I don't want to get into a mud throwing contest with CalNet, so I won't say how many times I've been called to their service area for similar things. I understand competition is a good part of this, but right now our discussion is really a focus on the rules that we're all to follow when going for a permit. And we do not feel that the gap in service has been met on that. Also, it does seem that staff has now gotten word that the co-location of those towers was deemed inviolable. That was not in the original application that was made public. So that is why that argument is in our challenge. Be happy to answer any other questions.
Okay, do we have any questions from the board for the appellant? Okay, thank you very much. So at this time, I'll open the meeting to, open the public hearing. And it looks like we do have a comment on this. So, so we'll allow the caller to have 3 minutes to comment on this particular proposal. You're on with the board.
Yes, I'm a property owner in Groveland within a half a mile to 3/4 of a mile of the proposed project. My name is Tom Tingley. And my comments are, one, on the service gap. There's a tower at the airport, which is probably less than a mile away from the proposed tower. I have Verizon service personally, and I have excellent service, 5 bars on my cell and 5 bars on my Wi-Fi. So I get excellent service from Verizon from the tower at the airport, which is exactly 1 mile line of sight. Number 2 is I'm concerned about the 70-foot tower within a half a mile of the end of runway 27 at the airport. I don't know all the details of this project, but my third comment is on the views of the property owners on Clements and Clifton Way, which is where I live. And my fourth comment is on the noise from the related equipment. I don't know if the related equipment is a diesel-driven generator and power outages to power the cell site, but those are my 4 comments. The reason for another tower within a half a mile of another one, the end of the runway issue, if it is one, and the top of the tower being seen probably by 15 or 20 homeowners in the area, and the last comment on the noise. All of the information I've gotten from this project has just been the last couple of hours listening to the previous presentations in the supervisors board meeting, and I'm probably missing a lot of details and uninformed on many of them, but the comments stand, and I am opposed to the project unless it can be shown that my comments are incorrect or not a concern by me and the other 3 opposed property owners. And thank you, Board of Supervisors. That's all the comments I have.
Thank you very much for those comments. I'm going to look to staff. Well, first, do we have any other comments? Okay. So I'll close the public hearing. I'm going to look to staff. There were some specific questions asked there. Can you address, I guess, starting with the, the proximity to the airport was the first issue?
So originally this tower exceeded 75 feet in height, and therefore it was referred to the Airport Land Use Commission. During that meeting, the ALUC members expressed concern regarding safety at the airport, and the applicants from Cal.net revised the tower height to the current height, which is less than the requirement for a review by the ALUC. And so that did mitigate their concerns regarding tower height and airport safety. With respect to noise, there will be equipment, including a backup generator, that's located at the base of the tower for use during emergency outages. It's not going to be used for regular operations, but only during power outages.
So going to that point, is there other equipment that will be used consistently in the operation of the tower outside of a power outage situation?
That might be a question we can ask the applicants. I don't
Okay.
know the specifics about the duration of the equipment and its operating duration.
Okay.
With respect to aesthetics, we've outlined that in our staff report that typically stealth design is required unless findings can be made, and those have been presented to your board for consideration today.
Okay. All right, thank you. Any questions from the board for either applicant, appellant, or staff?
Applicant, mentioned the cell tower, the Verizon cell tower at the airport. Could the applicant explain the difference between what he's putting in and the Verizon tower at the airport?
Yes, I can definitely do that. First of all, the airport site is a future site as well. We're going to need that to fill other service gaps that we have in the area. But just to kind of step back, we've been trying to work with Verizon and AT&T and even Conifer. We have messages out to them for co-locating on their sites, and they won't get back to us either. So we're really trying to work with everybody on every site here to do the due diligence that we were requested by Supervisor Brennan and others to look into the dig once policy. But the reality is we're not getting the kind of partnership back that we need to actually be successful in deploying this grant. So what we're doing is we're still working those efforts, but we're not going to rely on them because we haven't been able to successfully achieve co-location on an AT&T cell tower or co-location on a Verizon cell tower. And we have thousands of sites throughout the state. And it is a challenge for us, and it is something that we intend on eventually being able to do. But right now, those sites are off limits, let's just say, by the fact that those companies do not allow competition on their particular facilities.
Okay. And while you're still there, there was a question that was asked by somebody calling into the meeting regarding the type of equipment used and whether it will be noise. You know, I know there will be generators there, but is there any other equipment that will be used on a regular basis, not including generators for a power outage?
Yes, correct. And, on that particular site, no, there will not be a generator. We use a battery backup system that'll last 24 to 36 hours. Additionally, that site has a massive solar array. We purchase our electricity directly from the landowners. We reimburse them for monthly electricity costs. And in this case, we won't be doing anything but installing our cabinet, fencing, and the tower. The power on site is far more adequate than we need to provide for the facility 24/7, 365 during just about any kind of conditions.
Okay.
You might let the appellant respond to their answers to your question.
Is there any response from the appellant?
On which questions?
Either question. So one was related to the noise, and the other, forgive me.
Those would be according to the specs of those would be according to the specs of the application. So that is outside of my knowledge base, and so I rely on the applicant to provide those answers.
Okay. All right. Any other?
The other question was related to sharing towers.
Yeah. I think she answered it. Okay. Any other questions from the board? Okay. Seeing no questions, I'll ask for a motion. All right. If there's, I'll go ahead and make the motion. I move. I'll make a motion that we approve the conditional use permit CPU 20-003 based upon findings A through G, and subject to the attached conditions 1 through 34.
And I'll second.
So I have a motion by Supervisor Campbell and a second by Supervisor Kirk. I'll ask the board clerk to read the roll.
Supervisor Sherry Brennan.
Supervisor Brennan, are you with us?
Yes, I am. No.
Okay. What is your vote?
No.
Okay.
Supervisor Ryan Campbell.
Aye.
Supervisor Anaya Kirk.
Aye.
Supervisor John Gray.
Aye.
Supervisor Carl Rodefer.
No.
Okay, so the vote is 3 ayes, 2 noes. Motion passes.
Supervisor Campbell, before we move on, also on the agenda for this item is adoption of the indemnification agreement by and between Tuolumne County and the D's and/or CalNet. That was also on the agenda for the last hearing, so if we could, we'll need to take care of that for that last hearing as well.
Can we do that with a single motion?
If you reopen the other hearing, you can do that.
Okay.
So I will go ahead and reopen the hearing for item 21, or I'm sorry. For the second 130 appointment. And I'll look for a motion to include the indemnification.
Given that both have already passed, I move on the indemnification agreement for both of these projects.
Second.
Okay, I have a motion by Supervisor Rodefer, second by Supervisor Gray. And I'll ask for a roll call vote. And are we doing both combined or?
That's the way I heard the motion.
Okay.
Supervisor Sherry Brennan.
Aye.
Supervisor Ryan Campbell.
Aye.
Supervisor Anaya Kirk.
Aye.
Supervisor John Gray.
Aye.
Supervisor Carl Rodefer.
Aye.
Okay, motion passes unanimously. All right, thank you all. And thank you. Okay, so the next item is item 20. I'm going to look between the board to see if there's interest in tabling items 20 and 22. Do I have consensus on those two items? So tabling items 20 and 22.
I'm okay with that.
Me too.
Okay. Sherry, you good?
Yes.
Okay, so we'll move on to item 21. Board Clerk, would you please read item 21?
Consideration of approving Resolution 110-20, authorizing participation in the Tuolumne County Fire Joint Powers Authority and appointing a representative to the Board of Directors. Please call in now for public comment.
Okay.
Hello.
Good afternoon. Members of the board, Vice Chair Campbell, and Chair Brennan on the phone. I'm Liz Peterson with the County Administrator's Office, and this is Chris Schmidt with the County Council's Office. We are here today because per your board's direction this summer, we have continued to work with the other fire districts within Tuolumne County in the city of Sonora to form the Tuolumne County Fire Authority, a JPA for the purpose of jointly levying a special parcel tax for fire services. This tax would be levied in June of 2021. If the tax measure fails, the JPA agreement and the JPA would be terminated and dissolved. At this point, the JPA would be comprised of the following members: the City of Sonora, the County of Tuolumne, the Columbia Fire Protection District, Groveland Community Services District, Jamestown Fire Protection District, Tuolumne Fire District, and the Miwok Sugar Pine Fire Protection District. Both the Strawberry Fire Protection District and the Twin Heart Community Service District have opted not to participate in the JPA in the tax measure, but both are supportive of the JPA and the tax. Okay, so on October 20th, your board reviewed the draft Tuolumne County Fire Joint Powers Authority Agreement and directed staff to bring back the final for approval. The draft is included in your packet. All potential member agencies listed above have reviewed the draft agreement with their respective boards and council and had no substantive. Yes, that's it. Thank you. Changes to the draft agreement. Oh, yeah. And I also attached the staff memo from October 20th, which describes in detail the agreement. So as well as choosing to participate in the agreement and passing the resolution, your board will also need to select a representative and an alternative who will participate in the JPA as a member of the board of directors. The board of directors will hold their first meeting in January and will refine the details of the tax measure as well as approve a tax ordinance and then ultimately call for the special election. The board of directors must adopt a resolution calling for a special election by March 1st of 2021. And lastly, staff will come back to your board in January to further discuss and refine the details of the special tax. So just for clarification, while it's the board of directors who ultimately puts the tax measure on the ballot and defines the specifics of the tax itself, each board, including your board, will have the say and input into what ultimately gets put on the ballot. And so it is recommended your board approve the resolution authorizing your board to participate in the joint exercise of powers agreement for the Tuolumne County Fire Authority and appoint a member from the board to sit on the Joint Powers Authority Board of Directors.
Very good, thank you. Do we have any questions for staff?
Yeah, I have one. Why would the appointment of a person to this board be any different than the normal board appointments which are made by the chair and the new chair every year?
Yeah, I suppose it wouldn't. I think when we were looking at timelines for or trying to get everything in order for calling the election.
I have a kind of an easy solution to that, because if I make a motion to appoint
Carl Rodefer.
Supervisor Campbell as the primary and Supervisor Kirk as the alternate, and if he becomes chairman, he can reverse that.
Okay, I'm good. I just don't think that there's any rush. I think that whoever becomes chair next year, on the 4th, they're going to have an election, right? Or the 5th, I can't remember which.
Yeah,
but just let the next chair appoint them.
Yeah, the intention is that the board will meet in January, the board of directors. But yeah, I think by that timeline, that could work. Or to Supervisor Gray's point.
Are we going to do anything between now and January 4th or 5th?
I mean, if we've got it before us, then we can check it off the list so that it's in place by the time we have our first JPA meeting. I say, why not? So.
Okay, so I would move that
we need public comment.
I'm sorry.
So if there are any other comments from the board, I don't see any, so no public comment. I'll look for a motion.
Go.
All right, I move we approve Resolution 110-20, authorizing participation in the Tuolumne County Fire Joint Powers Authority and appointing representatives to the board. I would nominate Ryan Campbell as the representative and nominate Anaya Kirk as the alternate.
I'll second.
Okay, I have a motion by Supervisor Gray, second by Supervisor Rodefer. I'll look for a roll call from the clerk.
Supervisor Sherry Brennan?
Aye.
Supervisor Ryan Campbell?
Aye.
Supervisor Nye Kirk?
Aye.
Supervisor John Gray?
Aye.
Supervisor Carl Rutherford?
Aye.
All right, motion passes unanimously. So we've postponed item 22, so we'll move on to item 23. Would you please read item 23? GZ.
apologize.
There you go.
I apologize, I have too many papers right here. Okay, designation of the 2021 Rural County Representatives of California Board of Directors Delegate and Alternate. Please call in now for public comment.
Okay, so this is, as I know everybody on the board and many people on staff recognize the role that RCRC plays in advocating for rural counties like ours. But, you know, the public might not know all of the hard work that they do and the great value that they have played in many of the large projects that have taken place in this county. So with that, I would like to nominate Supervisor-elect Kathleen Haff as our representative for RCRC and Supervisor Anaya Kirk as the alternate. And I will look to see if we have any public comment.
I don't think we can do that. Go ahead.
Yeah. You need to talk into the microphone.
My suggestion is we bring this back on the 4th so that we can have this appointment because we haven't previously had not current sitting board members appointed. Thank you.
Let's do that. And the same applies for item 24. So we will table both of those items. Now, there was a time element involved, which I thought was the reason why we had it on the agenda. Hopefully we can reach out and make contact with the two organizations here to let them know that.
You have someone filling that role right now.
Yeah.
So they can continue to fill it until
Right.
you, as a board chair, you can make an appointment. And by the way, that has traditionally been a chair appointment.
Okay. All right. Makes sense. All right. So I will also look to the board to see if we'd like to table reports.
Absolutely.
Okay.
No, I've got about an hour and a half.
All right. With that, we'll adjourn the meeting of the Tuolumne County Board of Supervisors for December 15th. Thank you all very much.